Mohanji has been working at it for 15 to 20 years now, and I have been associated with that. And I see a lot of good work getting done throughout USA as well as India, and especially the people like us who want to do something and do it well and do it quick and contribute towards the India's growth and solving problems. So after I retired from IBM back in 2009, I said I don't want to do anything professional where I made my earnings. I want to do something very different. And that's where I focused on yoga first and meditation next. And say these are the pretty good Indian ancient technique, and I call it technology, which are very much useful to individuals in becoming their very best and remain their very best all the time in their execution, relationship, living, relating to life, and all that stuff. So I said, well, what's the problem for anyone wanting to do that but can't do it? So I started working on turning yoga and meditation into a business process kind of a flow. How do you teach somebody in a smaller chunk in a disciplined way? Therefore, they can learn and they can internalize. So it is as you all know, it is an internal journey, working with your mind and thoughts, and the yoga exercises helps around it, along with the different tapas or different disciplines, which makes it easier to do those practices. So I took a very simple value proposition and I am trying to take it to the corporate world from where I made my living and stuff. So it is simple that if you can manage your thought process, you can manage the outcome of what you are doing. So most of the time, people are very much what I call monkey mind. The idea come based on sensory input. They entertain. They think a very less amount of time is spent on what they want to think and think it consistently to the end in a creative way and get a good outcome. So thought process is the key. So thought process is essentially separating two kind of your thoughts and thinking from observing the thought. So if you are able to observe the thought, you can manage the thought. And when you manage the thought, then you can direct the thought to specific action, specific thinking. So that was the first, the separation that allow you to think about thinking and manage it. And in yoga and all of our Indian scriptures, there is a ton and ton of information. So I took upon myself to research all that stuff and come up with a simple process and say if I am talking to a group of people who want to just simply say they want to think creatively or they want to be stress free. Well, how would I give them a fast track demonstration of that through a specific process? So, so it can be applied to this team. And in last couple of session, I was facilitating the session through meditation. So all of us meditate for few minute or so, and then create a purpose in your mind, and then begin to see the thought process. And at the end of the presentation, we want to get the very best out of the presenter and push the envelope a little bit further, and that's the goal. So when we look at the presentation, we are right here today. Everything happened in past is past. Everything gonna happen in future is future. So you can impact the outcome by thinking differently right now and doing it thing differently. And so, with that goal, what I thought I'll take a couple of minutes to give you the flavor of the process that I have developed. And I call it a fast track meditation, which you can do almost anywhere. And so we will start with that one first, and then if you so desire, we can take a couple of other steps about the creative thinking and problem solving. And these are different techniques that I have that I've been working with over about 10 years now. And when I was working in the corporate world, I did it on myself, and it served me well. So, are you guys ready to have a 3 minutes experiment of your own on your own thinking? Okay,
Sure.
good, good. So, I'd like you to comfortably sit with your buttocks all the way in the corner of this chair you are sitting so that you get a straight back. Your feet flat on the floor, and if you can't reach the floor, consider putting something under so that it is flat, so that you don't feel the weight. Yeah, lower the chair like Mohanji did. Now, just to keeping the back straight, just go back and forth and side by side while you relax the entire upper trunk. And at some point, just find what I call gravitational vertical. So you are very much in an alignment. At that point, you may not be using your back seat at all, and that's okay. Make sure you are vertically straight so you are not using your weight as a cantilever. If you are like this, it just put extra pressure. So if you are very, very straight, the best you can, sometimes with trouble you may not be able to, but do your very best. And now put your palm on your thighs, facing up, and softly close your eyes. Now adjust the back again a little bit to make sure it is straight and comfortable. Now imagine that you are breathing through your entire body and delivering the inhalation to your lungs. You will pass that inhaling air through about 7 trillion cells, and make sure you start relaxing them. As you exhale, make sure those all 7 trillion cells are taking out all the stress, discomfort, pain, uneasiness, and just breathe. Now focus on your breathing through the nose, and take the inhalation all the way down to the bottom of the rib cage diaphragm. You should feel your tummy is moving out. And then slowly exhale. Now we're going to do a lot of internal observation to calm our nerves and thought process streamlined. First, observe the warmth of the air you are exhaling compared to inhalation. At this point, probably your breathing has quieted down a bit. I want you to focus on next is in hold. After you completely inhale and before you start exhaling, allow some microsecond in between. And see if you can increase the in-hold gradually without effort, just on your thought process. The in-hold is called meditative moment. That is when your creativity is energized and you get to connect with the knowledge you don't have, or knowledge that you are seeking. Next, feel the connection through your feet with Mother Earth, and you are connected with the trees around the world, and half of your lung is hanging on those trees, converting carbon dioxide to oxygen for you. Now simply keep on breathing slow and easy at the pace you feel comfortable. And behind your upper eyelids, feel it as a TV screen with multiple colors, whatever colors comes to your mind. Now begin to isolate colors to a single color, the whatever the color is your favorite color. Blue, orange, yellow, red, black, white, doesn't matter. And without counting, after about 5 inhalation and exhalation cycles, open your eyes gently Now, for a brief 10 seconds, I want you to close your eyes again and observe the experience at the start of this session and at the end of the session. Just scan your body and make observation. Relaxation, easy, pain point, thought process. How does your head feel, forehead feels? Just observe. And that observation are just for you. No need to share with anybody. And open your eyes. Okay, so we took about 10, little over 10 minutes or so, and I just purposely went beyond 2, which I promised at the beginning, because we had some time right now, so I wanted to give you the feel about how you manage your thinking with some small steps. And this techniques goes well beyond the one that I introduced you today. But in my teaching, I find that if on 0 to 10 scale, 10 being the most relaxed and zero being very agitated, most of the people see at least difference of 2 in the right direction within 10 minutes. And it just clears your mind, clears your head, and now you are ready and to grasp the topic you're gonna listen. See what you want to contribute at the end of the presentation. If you do this session, then it summarizes what you heard and what you're gonna do. So I'm introducing this technique to the corporate world in managing meetings, managing conferences. And in those meetings, it's the first 5 minutes and last 5 minutes of the meetings. And I'm trying to reduce that down to 2 minutes and still give that experience. So, in conclusion, I'm so much so convinced about the science of meditation, and yoga is to help do meditation better without the aches and pain. That I think this would be a corporate technology like a quality control, research, 3 Ps and 4 Ps and all that kind of stuff that corporate world has. This has to be one of them. And I'm just passionate about it, and I just go about doing it. So thank you for checking along with my experience and experiment. Any comments you might have, happy to listen, answer any question.
Well, thank you very much for sharing your techniques, and I hope all of us will try to practice them before we do anything big. So we are relaxed, and then we can be more productive or more effective in what we plan to do, presentations or any big action we plan to do. That one.
Yeah,
So thank
just
you very much. Yeah.
welcome.
Uh,
I just want to say, show of hand, if did you see 2 point difference on 0 to 10 scale in a right direction?
yes.
Okay, good, good.
Yeah.
Yeah,
So,
thank you.
so
Manji, we plunge into the next session, education. No, not sorry, the healthcare. Hmm.
healthcare. I think I
Avi,
don't know.
yeah.
They are not told, but two speakers we had before, uh, they somehow or other decided not to join. I don't know what happened. They didn't inform me that they will not come. So anyhow, we take advantage of what we have. So we have little extra time. So it's about 8:15. What is that? 8:15 time in India. So it should be done by 10 or so. So let's try to have uh, start with Dr. Shelly Batra. I think there, the, each one of you can have little more time. So because we have extra time at this time, so 15 minutes is the presentation time, and then we have 10 minutes or so for question answer interactions. I think that's what we should try to manage. Uh, so thanks again. Uh, I think you want to have a short introduction, Chitanji, of the each speaker, and then we can.
So is Avi Arya? You are listed as a moderator for this healthcare.
Hello, hello.
Avi, Avi.
I think you are doing it right. I thought you were doing it right.
I, I'm okay with it, but I think you might be more prepared than me.
Yeah, you guys decide whatever you going to want to do. Whoever wants to do that's fine. If not, then we
Yeah.
can continue. Yeah.
No, I can do it. That's not a problem. That's not a problem.
Okay. So just give a short introduction. We shared the profile with everybody,
Right.
of course, and then have a Dr. Shelly Batra starts her presentation as soon as possible. Okay.
So let me share my screen. I think it might be better that way.
You have that one, right?
Yeah, I have.
Yeah. Okay. Thanks.
One second. So can you see my screen?
Yes.
Okay. Thank you. Dr. Batra, can we start with you? Uh, we have a very brief profile. I think your work is much larger than that, but I just want to get started with a brief outline. Overview of your work that you've done here is on in the field of healthcare. I don't know how much to say about that because we have all this information about you. So I don't want to really commit with you and the audience. So why don't you start with that? Pick up from here, or you have your own presentation. But why don't you explain yourself, your journey as a medical professional and other areas, and then you can focus on your specific topic that you want to talk about. Is that okay?
Okay. Thank you very much. Let me begin by saying that I'm really grateful to all of you for this wonderful opportunity of talking about myself and my journey, and also discussing the very essential link between poverty and disease. So I joined King George's Medical College a long time back, and that was in 1977. Then I did my MBBS, my MD, my specialization, etc. And I did clinical practice for more than 3 decades. Even right now, I'm the head of the Department of OBG in a tertiary care hospital with 5 specialists and 12 resident doctors under me. I'm also the CEO of Every Infant Matters, which I joined last year. Prior to that, I had established another NGO in 2005, left it last year because of huge financial bungling on the part of the CEO. Now, there is a lot of work that I want to talk about, and I think I should just go on to my slides. Would that be okay?
Absolutely.
Uh, okay. So, how do I get my slides now?
At the bottom, you have the screen arrow, the square with the arrow in the bottom. You have that? Yeah, it's coming up.
Yeah, yeah.
Yeah. Now we can see your screen. Now it's switch to your tab to that slide.
Okay, should I open my slides now?
Yeah.
I'm more familiar somehow with Google Meet, with the Zoom. Not so sure of
Same
this.
with the same thing.
Can you see my slides now?
No, we see a white screen. So that you are sharing.
Hello, can you see my slides?
No, we can't see your slide. We can see a white screen that you are maybe on a different tab. So can you start to share again? Open your presentation in the
Okay.
background and switch to that. Start the sharing part.
Okay, let me start with I'll stop sharing. I'll
Yeah.
open my presentation.
Mhm.
And then what do I do?
Again, start sharing
Okay, let me go
and
back.
share desktop. I think you have an option, right?
Okay.
What to share?
I'm afraid I'm a bit
No problem.
technologically
No,
challenged.
no problem. It's very simple. Yeah.
Okay, I've come here. Now I go to the square with the arrow.
Yes, please.
Present now.
Mhm.
Okay, I go to entire screen or window or
Yes,
tab.
yes, yes, yes. Do that.
Which one?
And at your presentation, you have it. What are the
Yeah,
options you have?
I have a PowerPoint which I've opened
No,
already.
what are the two options you have in that?
Your entire screen, a window, a tab.
I think you share a window. I think let's try a window.
Okay,
And can you see that presentation in the background now?
somehow
Yeah.
I'm not able to. May I request Mohanji?
Something is coming up. Okay.
Okay, let me try opening once again. I'm terribly sorry for this.
No
I
problem.
apologize for wasting everyone's time. Has it come up now?
No.
Not yet.
Avi, do we have the option to share? Has the admin given us the option?
Yeah, yeah. Anybody can share. We could see her screen, right, earlier. So,
Yes, I could see yours and Mohan's also, but we can't see Shelly's.
Yeah, and I've opened my PowerPoint. I'm just not able, I just fail to understand
no problem.
what to
Try,
do.
don't worry about that too much. Just try again the sharing part of it. The bottom.
Okay,
Yeah. And try your entire screen. Let's try that.
okay. Could someone do it for me? I've gone to the vertical arrow. I'm
Yeah.
going to the entire screen now.
Yeah. Go ahead. You have to select that entire screen. You have to select that on the right side. You have to
Yeah,
select that three option, entire screen option.
yes, I've shared. I'm
Can you see?
presenting the screen.
Can you see my screen now? Yeah, that's fine.
Is
Yeah,
it happening now?
yeah, it is happening. Now you share your entire screen, right? Yeah, we can see that. Now, can you tap to your presentation? Yeah, we can see your presentation now. Yeah, good.
Can you see my presentation now?
We can see it. We can see it. Yeah,
We can see it.
yeah.
Okay.
I
So
think you should go for slide presentation. It will be better. But
can you see my slides changing?
Yes, yes, we can see.
Okay,
Thank you.
so let me begin with this. I apologize for the delay. I'm CEO of Every Infant Matters, and we are fighting health inequalities worldwide. I come to the next slide. Is this visible, the 6-year-old boy?
Yes, yes.
Okay, so Dr. Leela Raju will talk more in detail about this issue, but I want to talk basically about the farmer Ram Simar. When the 6-year-old boy became blind, he could see, he had vision. At the age of 6, he became permanently, irreversibly blind just because of lack of 2 drops of vitamin A. The farmer had to sell his farmhouse. They had to resort, his farm, sorry, not farmhouse. They became beggars overnight. And they had to run from pillar to post in order to access treatment for the son. What I'm trying to say is that there is an inextricable link between poverty and disease. So these are the children who will survive on small quantities of boiled rice. And when they have no proteins and no vitamins, they get every kind of disease, disability, and even deaths. Am I audible?
Yes, yes,
And my slides are visible?
yes. Very clear.
Okay. Let me very briefly come to this. Hunger leading to malnutrition leads to a lot of deficiency disorders. Protein deficiency, deficiency of essential micronutrients. There are babies born with low birth weight. There is high neonatal mortality, under 5 mortality, maternal mortality. All these are linked to malnutrition. And hunger and malnutrition themselves cause diseases. There is stunted growth, poor school performance, there are recurrent infections, rickets, anemia, and of course, irreversible blindness that I had mentioned. Now, all these diseases lead to poor school performance, and everyone in our country knows that the best way to lift yourself out of poverty is to get educated. But if there is no health, there is no education. If there is no education, you become a laborer. There are no job opportunities. That itself leads to poverty and hunger and malnutrition. And this vicious circle, this cycle goes on and on and on. Somewhere in between, you see this red flag. Who will pay for the treatment? So a man loses his farm, his means of livelihood, his cow, his goat, his wheelbarrow, sewing machine, whatever, to pay for treatment. And that is how starvation begins. We talk of these three SDGs: ending poverty, ending hunger, and good health for all. But as I have mentioned, all three are linked together. And there is a cause and effect relationship. 250 million children suffer vitamin A deficiency. And I'm shocked to find that the highest number, the biggest burden of irreversible blindness is in India alone. Of course, hunger is not about just feeling hungry. It's about these infections and this pigeon chest deformity, rickets, and stunted growth that you can see. So we started work in this space by developing partnerships in order to develop a high impact, scalable, and replicable model. Our first partnership was with a US based 501c3 not for profit called Vitamin Angels, which give us free medicines. They are giving free medicines in 70 countries. And we are working not just in India, but in Nigeria, Kenya, and we are carrying on discussions in Rwanda, Philippines, and the Dominican Republic. So this was the first partnership. The second thing we did was to build implementing partners. The Indian Medical Association, the charitable clinics in the gurudwaras, in the churches, local NGOs. All these people are implementing our projects and carrying out our work for us. So partnerships help in giving us free medicines. We also are able to reach the poorest of the poor at the very last mile in the remotest part of the country. And we have a low cost and a high impact, all because of the partnerships. Some other partnerships I'll briefly mention, apart from hospitals and NGOs and all the rest of them. One very big partnership is with Catalyst 2030. Now, this was an organization, an overarching umbrella organization established at the World Economic Forum's annual summit 2 years back, spearheaded by the World Economic Forum, Skoll Foundation, the British royal family, and a few others. And it has got hundreds of NGOs under its umbrella. And this helps us to get visibility for dissemination and for funds. Another organization that also started at the World Economic Forum was One Young World, and where my daughter Radhika was invited to give a keynote speech once in 2018 at Hague and this year in Munich. And now she's the One Young World ambassador. And once again, that has helped us connect with implementing partners across the world. So I believe every partnership is important. And one very big partnership is with the India Development Coalition of America. And I'll come to that later. So we prevent hunger and its serious consequences. A hungry child cannot go to school. A hungry woman, a hungry man cannot work. These are the reasons of poverty. Our projects promote nutrition. We give vitamin A, we carry out deworming, holistically we educate people, and to promote breastfeeding, immunization. There are many harmful myths in our country. For example, and some of them can be life-threatening. For example, put cow dung on the umbilical cord. The child will die of tetanus. If a child has got epilepsy, brand the child with a hot iron. The baby will die of shock. So all these myths are debunked by our community health workers. We also teach people how to get nutrition at a low cost. You can't buy apples and anar, expensive foods. Buy bananas, rich in potassium, rich in essential minerals. This is the education we give. And of course, we prevent stigma, discrimination, we promote gender equality, and we've done a lot of work in COVID-19 relief. I'll come to that later. So we work at the very last mile by working in slums, villages, orphanages, with doctors, homeless children, charitable clinics, and so on. One example of our work is on 17th January, we carried out simultaneously 225 health camps in partnership with the National Medicos Organization, where more than 75,500 patients were given the health check, primary care, basic medicines, and more than 4,500 children given vitamin A and deworming. So these are the kind of projects we like to do. We've had a huge impact so far, more than 60,000 children given vitamin A. The numbers have gone up recently. I'm afraid this is about 4 or 5 months back. But you can get an idea of what we do from this. Our priority, of course, is now we want to develop technology. We are looking for donors for that to carry out education, because our health workers, they are not doctors or nurses. So we want to give them a little smartphone or a low-cost tablet to carry out education, screening. We can track their movements. There's accuracy of data and so on. The One Young World calculated our social return on investment to be 72 times. That means for every dollar you invest, the return is worth 72 times. Now, this is so far about our core projects. I'll take a sip of tea here and then tell you why we started work in COVID. First and foremost, COVID was an immediate need last year. And this year, in the second wave, the need became even more immense. The other reason, as Mohanji has said, we are talking now about poverty and what to do in the poverty pandemic. So I always say that COVID did not come alone. It brought with itself another pandemic, and that was poverty. According to Azim Premji University, 230 million Indians have been pushed into poverty in the past 1 year. And of these 230 million, the poorest 20% households have got nothing left, zero income. How are they surviving? It is impossible for us to even think of the challenges they are facing in their day-to-day lives. So we started COVID relief in 4 countries, and in India we were working in 14 states of India, including the northeast of India. Should I take a break? Is there any question or any comment so far?
Well, I can comment on that. There's an incredible return on your investment. If you're giving
Yes.
72 times
Yes.
back what one is investing, that's a huge return. So your percentage of admin costs and others are pretty low in that sense, or can you
Oh,
explain
our
about that?
admin costs are very low. Our total costs of admin and fundraising combined are less than 10%, which is the best in the world. And we get a huge leverage because of, number one, free medicines, number two, free implementation. So when the Indian Medical Association carries out camps and does vitamin A distribution and deworming and protein supplementation and health education, we send one person. They send hundreds of doctors to do the work. So getting this kind of support in implementation and monitoring and evaluation gives a huge social return on investment.
So can you talk more about your cross-functional training? Apparently, India is a very hierarchical society, and everybody does their own job, right? They don't.
Yes.
Nobody wants to do somebody else's job, right? So can you talk
Yes.
more about the culture, uh, you know, culture that you have built in terms of doing cross-functional jobs and not just being depending other people? Can you talk more about that, please?
Yes, that's a wonderful thought. So now I will give an example. So all over the country we have the gurudwaras, and gurudwaras have charitable clinics. Now they are buying medicines, they are hiring doctors, they are hiring nurses, and there are people sitting there every morning from 9 to 12, Sometimes they are general duty nurses. Sometimes there is an MBBS doctor. So, what we do, we give them the medicines. We tell them what dose has to be given. We give the technical support. This much is the dose of albendazole for a child less than 5 years, this much for more than 5 years. These are the bottles of prenatal multi-nutrient, multi-micronutrient supplements. You give one bottle to each woman in pregnancy, and all the medical training we give, plus the medicines themselves. So everyone wants to add to their impact. Everyone wants to do bigger, better, faster, and economically. Because of us, they are able to do so. This is how partnerships work.
Great. Thank you.
Okay, so I'll go back to COVID. So, one of the first things we did was last year, in the remotest part of the country, near the Indo Myanmar border, we found that there are 70 villages near Singhanat village, and there is only testing, that 2 miles away. And after testing, nothing is happening. The government will say, okay, you are positive, now do what you feel like. So, what we did, we co created a COVID care center in a church that was converted into a high school, that was attached to a high school, St. Joseph's Church and High School. And the local people became our volunteers and caregivers. There were no doctors, no nurses, nothing nearby. So we gave them training what to do if a patient comes positive. We provided them with PPEs and masks to protect themselves. We gave them the medicines, oxygen concentrators, pulse oximeters, you name it, and we provided it. And I'm happy to say that in these centers, more than 500 people have been admitted. 135 were patients of COVID, only mild to moderate cases, of course, not those with severe disease. And about 300 to 350 people have come for quarantine and for isolation. And this work is still going on. We've also sent huge amounts of equipment, and 50,000 sanitizers were given by Mr. Adi Godrej on one phone call. Then 168 oxygen concentrators, then masks and BiPAP machines, everything was sent to various government hospitals, district hospitals in Manipur, district hospital in Sikkim and other places, and primary health centers, of course. Now, this is one interesting thing that we started in April this year, during the second wave, when suddenly we realized that hunger is becoming a huge pandemic, so to speak. So we started with 200 meals a day. In my card, we would put 200 meals. Those were donated by Zomato. They had a kitchen here in Delhi. Today, we are distributing 6,000 meals in 4 states: Delhi, Calcutta, Guwahati, and then in one small part of Maharashtra called Latur. Now, these are people who are homeless, they are hungry, they are sex workers. Obviously, sex workers, they have children and no father for the children, no one earning, manual scavengers, transgenders, who are the most marginalized, and most importantly, migrant laborers. And you can see this is a big amount of roti and curry being given to this child. And I'm so grateful to Mohan. Mohanji say, I phoned and said, Mohan, we are distributing, we don't have funds to pay the driver, we don't have petrol key costs, and IDCA was one of the first ones to support us. And I'm so grateful to all of you. And with everyone's support, the work has gone up from 200 meals to 6,000 meals. And now not just in Delhi, but in 4 states. We also distributed 3 months back, 200,000 kilograms of rations in these 8 states. This was funded by Crypto Relief. And I'm proud to announce that today only I got a message from them that they are now giving us funds to distribute 350,000 kilograms in flood-affected areas. Because, see, it was bad enough with COVID and loss of jobs. The jobs are not back yet. Poverty is there. And now the floods are there. Homes are swept away. Crops are damaged and destroyed. What are people to do? So this huge project we are going to start soon after Diwali. This is just a picture from Sikkim, and our health worker climbed up the mountain to reach this hut where this woman was living alone. No family member, to support and no jobs. All she would do was to sort of pick up a few sticks and sell them and get a handful of rice. We supported India's vaccination drive by carrying out 5 vaccination camps in Delhi with 9,000 people vaccinated, including those from the economically weaker sections. Last year also we carried out this distribution. Again, this was funded by Zomato last year. We also distributed a whole lot of thousands of PPEs and masks in medical colleges and hospitals run by the government of India. And this was funded by Refinitiv and Sri Ram College of Commerce Alumni Association. And we also gave equipment to people whom no one's interested in: ambulance drivers, security, housekeeping, front desk. These are the people we supported last year. We've also carried out this health system strengthening because you see, frontline health workers are here to stay. So we are training 1,300 nurses and nuns in India on COVID care and 100,000 community health workers. You can see most of them are women, are being trained in Nigeria. This year, about 2 months back, we started a community care COVID care project with 25 health workers in 2 states, in Delhi and Rajasthan, where there is a door-to-door visit by these health workers who find people at risk. They give them testing, treatment, free consultation. They deliver medicines, rations, vaccine awareness, everything. And this is going very well. So very briefly, I'm glad that Radhika got the prestigious Prashasti Patra, the Government of India Award for being a COVID warrior. This was last year. And this year, the Indian Medical Association Doctors' Day COVID Warrior Award. Mr. Modi made a virtual presence. He could not come naturally for the award giving, but we were proud to have him there. And we were also selected by the World Economic Forum amongst the top 50 India COVID responders. And this is the badge that we have been given, and we can use it. So with this, I come to the end of my presentation. And I believe no child should go hungry, no person should go hungry. Because what Mohanji says, poverty to hatana hi hai. So if we give food, we give health, only then can we fight poverty. So with this, I come to the conclusion of my talk.
Okay, the flow, excellent presentation. Thank you very much. Very enlightening. Just to understand, yeah, it's great.
Yeah. Everybody can clap.
Oh, thank
You
you.
are pan India in that sense. You're operating all over India, or you have specific region that you are operating?
So we started our work in Delhi. Then the vitamin A albendazole prenatal vitamins and holistic health program is in several states of India, the neighboring states such as UP, Rajasthan, and a lot of our work is in the Northeast because these are really the remote parts of the country. Now I was not able to go beyond Guwahati because of the situation over there. But my manager, Mr. Abhinav Agarwal, he went all the way to Arunachal. And from Itanagar, he took a bus and tried to reach the border, but the army had pledged support and couldn't reach there. He visited the centers over there, the healthcare centers, and incredibly, the infrastructure is primitive to say the least. Deliveries are being done on the floor. There is no episiotomy. If you want to give a cut, there are no scissors. There is no sterilized equipment. They are using a bamboo split in half to make a cut in the birth passage to deliver. And the woman is welcome to bleed to death because there's no suture material. It's horrifying. It is horrifying. तो जितना काम कर ले नॉर्थ ईस्ट में उतना कम है. So this is why we are doing a lot of work over there. And then the funding we're going to receive for rations, a lot of it is for Sikkim, West Bengal, and all these flood areas in Assam, the tea gardens, and wherever the floods have happened. Of course, Uttarakhand is another big area of our focus. Pori, Garhwal, Rishikesh, then Haldwani floods, all these areas we're going to start work.
Yeah, it's great to hear about work in Northeast because that is mostly neglected. Just people don't even think about those areas as being part of India. So it's great to hear work there in Northeast. Thank you for that.
Yeah, and
Please.
thank you for saying that it's neglected because I've had donors who say that government is providing everything. And why should we support the work? I mean, Leela is smiling. You can understand what the situation
So
is like.
I wanted to say congratulations. That's amazing work during COVID. That is remarkable. A couple things I wanted to ask. I was actually going to bring it up in my talk too. Is that we were trying to do more of a prenatal program around our hospital, and I think we could probably piggyback off a lot of what you're already doing, mainly getting same idea, trying to get fresh produce and the vitamins and then do the education at the same time. So I definitely love to talk later and figure out how we can kind of maybe even work together on that project, because we have the ability to reach the people in a different area than where you are right now. And then secondly, we've been thinking about taking a trip to those states for a long time. And if there at some point when you're we're able to do a more robust program, I think we'd love to come do an eye screening with you guys at the same time.
Yeah, we'd be delighted to work with you. We can talk any evening this time or any morning your time. I have no problems. And I'd be very honored to work with you. So I want to tell you one thing, Leela. It's all about local people. I cannot go with my peculiar hair and peculiar accent and work in any part of the country. But getting there, training everyone, giving them support, technical support, that is our USP, that is our forte. And we'd be honored to work with you. I know your father very well, and he's a very fine gentleman and a very, very illustrious member of the Indian diaspora.
Any other question for Dr. Batra?
I
Anybody?
had one more. Obviously, being in the U.S., I haven't been able to go to India now for about a year and a half, which is unusual for me. I usually go twice a year. But how are the numbers in that clinic where you guys helped train the local people to treat the milder cases? Because I have friends here that were calling around trying to find a hospital bed for their family in India. I know people. I'm in New York City, so I actually volunteered when we had our surge. I've never seen anything like that.
So it was horrifying in the second wave. People were desperate for a hospital bed. There would be long lines waiting list of 200, 300 people in every hospital. So in every Infant Matters, my daughter got COVID, and while she was in quarantine, she started this COVID task force. And there was this team of 200 volunteers across the country, mostly physicians, some, from the corporate world, some young lawyers, very dynamic people. All they would do would connect, find out where there is an availability, ventilator here, is there a hospital bed, is there oxygen? People would not be able to get an ambulance, not for love or money. People didn't know where to go for cremation. If there's black fungus, they don't know how to get the medicines. It was horrifying that time. Now things are sort of abated. The pandemic is waxing and waning, as you know. Numbers are now coming on the rise again in India. A very slow rise has been perceived in the past 3 weeks. I would not recommend travel to India right now.
Leela, if I can come and answer some part of that. Actually, the major cities had problem because the small nursing homes do not have oxygens. The main big hospitals didn't have the problem. That's why the whole thing went really bizarre, because everybody who thought he had COVID wanted a hospital bed. And if you could afford it, you got a hospital bed. That's where, instead of fine-tuning, saying that, making a guideline to the thing, these people do not need admission as you all have done, these people need, that was not followed. So I think that went out of control, and especially city like Delhi, where there were the smaller nursing homes, the availability of oxygen was not there for each patient. And suddenly people started making oxygen plants and oxygen concentrators. But that is, we all have to understand that 0.1% of the people required that. But those 1% people did not get, and others who were not supposed to be in the hospital were in the hospital. So that was the main issue in India, and that got amplified in the media and all those things.
Yeah, that's very true, Rohini. And the same thing is happening now with dengue. My husband's a specialist in diabetes and thyroid in Apollo Hospital. So every patient with a slight cough or fever will say, "We've got dengue fever. Please admit us. Platelet count 1.5 lakhs,
Yeah,
but you."
I think that's Shelly. That's where we Indian doctor, our
Yeah,
community failed. We should have put a guideline and said and given it to the government and said this is what we should follow. But the bureaucrats and everybody else took over COVID
yeah,
management rather than the doctors.
yeah.
So that was the issue. But
Yes,
Shelly, I would like to say that a lot of work which you are doing, we are doing in a slightly different manner. And we also did COVID one. We took one lakh people who were the remote place in Maharashtra, and we went door to door screening. And we created, as I was telling Avi, that we created a software which we would love to share with you, which had an AI. So our social workers went with, and we gave them a tab, and we had college students. We got them associated with us. So we taught in each pada, we taught one educated person from that pada how to uh, detect diabetes, hypertension as symptoms, and how to create awareness and how let people go for vaccination, take them for vaccination. And that model worked fantastically because even the places where people were saying, I'm not going to get vaccinated, everybody was like, we got 80 to 90% people said, yes, we'll get vaccinated because you all have explained to us. So the creating of awareness is, as Kelly says, giving technical knowledge by we doctors to the people who are going. And as she said, the local people going and talking to them makes a whole lot of difference, in putting forward the message rather than having a Shelly and me with our haircut, short haircut, and going and wearing sleeveless, and that doesn't make. But if we do wear a sari and we talk their local language, it really makes a great difference.
so this is stupendous work, Rohini.
Yes.
This kind of work that you've done, vaccine awareness and
And
birth awareness.
as you rightly said, we found 30,000 people who are below poverty level.
Yeah,
So we also did a similar thing where we are giving them rice pulses because government only gives rice and sugar. So
yeah,
we are giving pulses. They eat fish, so we can dry fish, give them proteins in different manner. So
wonderful.
therefore, I think it is important to identify these things.
Yes, and locally sourced food products, like you said, right?
Absolutely right,
Yeah,
because that's in that area they eat dry fish.
yeah,
So instead of giving them something else,
yeah.
it's better to give, and even we some, and give the oil which they like to
They
use,
like, yeah,
rather than giving Postman or Saffola.
yeah. Absolutely, very good thoughts. Thank you.
Any other question, Dr. Batra?
Thank you very much. Excellent presentation. And you said don't come to India, but I'm coming next week. Anyhow, I already decided I would like to be in all the struggles there. I was there last year also, almost 6 months through the lockout. And I visited again this year in March, just before you had a big breakthrough. So I'm daring again. Let's see what happens. We'll see.
All Mohan, all you do is double mask and come to India. Not to worry, we are safe
Yeah,
now.
I'm already triple vaccinated.
That's good.
good.
I got a booster also. I got a COVID also last year. So 4 times, vaccinated. So I
So
hope,
you have enough antibodies to come to India.
yeah.
Good.
So if I will survive, I'll survive. I have still to do something. I'll survive. If not, then like so many people go every year. All have to go. So why too afraid of the death? The time has come. We will go. Nobody can stop it.
I think the
All the
time has come where you have to do a lot of work for the
if
country.
I have to do, then I will be, available. I will be kept
Yes.
alive. If I have nothing to do, then say, okay, go now. So that's why I'm not afraid. And I had good experience during the lockdown. I get to know everybody in my building. They all fed me there. I was alone there. Of course, because nobody was allowed from outside, no help. So all the people in the building, they send me all the nice food, warm food. So it's a good experience, a positive experience I got staying there, and everybody had time before everybody was running around. You know. So so I'm daring again. We'll see. Whatever happens, we'll deal with it. You know. So thank you again, and uh, Mr. Krishna Khanna has joined also. Who was supposed to speak, and but we'll have him after we finish the healthcare session. So we have. Please go ahead with the. If there is a question, you can speak. You know, Avi, please take over now. Thank you.
Yeah. Mr. Krishna, can you mute yourself, please?
I think somebody is to mute. You know, we're getting a lot.
Uh, Dr. Krishna, can you mute yourself? Thank you very much. Yeah. Okay. So Dr. Rohini is the next one. I will just share her brief bio, but I would like again for her to take care of this one and talk more about herself. So just give me 1 second, please. So can you share my screen, please?
Yes.
Okay. So Dr. Rohini, I will not be in between you and the audience. And please go ahead and talk about your life journey and what you want to talk about today. So please get started. Thank you for that.
Yeah, thank you. Thank you. The entire screen share now. Hello. Can everybody see that?
It's coming up. Yeah.
Yeah.
Thank you.
I think something is happening.
I think we can see two parts of your screen. We see the presentation in the background.
Okay. All right. Can I switch off that two people? Okay.
Multiple sharing is happening. So can you back to one of them? Yeah, the main one. Yeah.
Okay.
Yeah,
So
just maximize this one, the PowerPoint. Can you maximize the PowerPoint, please?
No, I think
stop sharing and start again, please, if you don't mind.
Yeah, I stopped presenting. I'll
Let's
go
start
back.
again.
Let me open the presentation. Can you see it now?
Not now. Yes, coming up. Yeah, great.
Yeah.
Perfect. No, it went down again. So can you
Yeah.
put it?
Can you see it?
Yes.
Yeah. Can just maximize it, please, if you don't mind. On the
I
top,
will do that.
top right. On the top right. The
Yeah.
PowerPoint
Is that
itself. Yeah, perfect.
That's good.
Perfect.
Perfect. Yeah.
Okay. I'm Dr. Rohini Chowgule. I'm a pulmonary physician, and I have a link with all of you. I did my pulmonary fellowship in Loyola Medical College, and I lived in Chicago for 3 years and had a wonderful time over there, and learned how to do practice medicine in a different way. But other than talking about myself, basically I've been always working on community health and doing research in asthma and COPD in community health. But Impact India Foundation, I think, is much more interesting organization than me. So it was established in 1983, and it has 38 years of inspirational journey, which I would like to share with all of you. Now, once upon a time, we had a wish. We said a simple and a bold wish that people should not go through neglect and ignorance to become disabled. So that was our main thrust point. So our vision was to catalyze strong healthcare system to make India disability free. And our mission was to create robust and replicable healthcare model that can scale up through partnership to reach underserved population of India. We have two branches in our organization, our foundation. One is preventive and one is curative. And how we started was initially as you all know, in 1983, polio was a main cause of disability, and it was there in the villages and all. So we took up that issue and started working on polio, creating awareness in different parts of the country. Can everybody hear me? Hello?
Yes, we can very
Yeah.
clearly. Thank
Okay.
you.
And then what we did while we were doing this awareness, the polio vaccination and awareness program, we realized there was young children who had disability. And as Dr. Bata very rightly said, disability causes poverty, and poverty and disability should be in par equal. So this is how where we started doing. These are pictures which are with started immunization program and disability program. Our target population is always been aspirational area in the villages, and this is how the people live over there. We go to remote places all over India, and as you rightly said, that Northeast is our last 2-3 years we have concentrated on Northeast area. So we have gone multiple times to Tripura, Orissa, Jharkhand, this Assam and all those places. So initially we had 5 Lifeline Express mobile clinic, and Dr. Bata pointed out to you all vitamin D deficiency was deficiency was a major issue for blindness. So these mobile clinics would go and do vision testing. So we would go to 7 blocks of the tribal place in Maharashtra, and this kind of mobile van created awareness in all the villages. You can see all the people all smiling, and they realize this is a magic bus is coming, and they can see, and they used to go administer vitamin D plus refractive error. We used to check and give them glasses. So this is how we got really connected with the tribal area of Maharashtra, Palghar. During our time, we realized that malnutrition and nutrition deficit causing cleft lip and multiple disabilities were the cause for the malnutrition which was occurring. So we took up this issue in Palghar district. Then, actually, our community health program, which was in Palghar, this is a holistic approach for better health and disability prevention through education, we thought. So, early detection and treatment of disabilities, health and nutrition education, preventive health through clinical intervention, and mostly we empower the village health people, sanitation people, the AAA, the ASHA workers, the Anganwadi workers, and we also have revived Anganwadis, like I would show you further on. And then we had community-based programs where we would teach people in the community, and we would use this Anganwadi, and that's why we refurbished the Anganwadis. Our target population are pregnant women and lactating mothers, newborn till the age of 2, infant age between 3 and 6, and school children between 17 and 14, and adolescent girls 15 to 19. Why we took this? Because we feel we should educate the children while they are in school, tell them about anemia, tell them about deworming, tell them why we are doing this. Then these children become adolescent, because adolescents are the future mothers, and if we can train them to be healthy, they will produce healthy babies. So this is how we worked in this community health. So area was, we then also would identify high risk pregnancies, low birth weight, and malnutrition was our focus. So what we did was we would teach the mother, not only mother, but the mother-in-law and the sister-in-laws about what is the importance of nutrition in pregnancy, and we would actually demonstrate to them what the mother should be, why they should go to antenatal clinics, why should they weigh the baby and all. So this was taught to them 1:1, and we had a great success in that. And because of that, for next 5 years now, we are going to carry this program in 1 lakh people in this Mukhara area. And this is how we gave the education. We actually made food festival. First, we would tell them what are the different, like what rice has, what pulses have, where is protein, where can you get your, micronutrients and all. Then we would ask them to go home and whatever is available, make some food from the what we had taught them. And as you can see on the right hand side, these are the products which all these ladies made, and we would have a first prize, second prize. So we would encourage them to create awareness on the food which is locally available. So we also made encourage them to have the home gardens, kitchen gardens where they could grow vegetables, Then we would cover up the school and non-school going children, pregnant and lactating women, and give them talks on it, collect them in the school and tell them what the different things are. So it was like a community kind of programs. And also what was important is that we also had on nutrition, importance of immunization and right age of marriage and spacing of children is the one we were all concentrating on. Our community health workers would go over there. So we are doing this prevention of health through clinical intervention is that we gave immunization, measles, rubella for all the girls, deworming, anemia reduction, and we would encourage the women to go for pre and post checkups. And school health checkup is one of the important things. Now, as I told you, we refurbished 100 Anganwadis, but that because we made them attractive, so we got more. And these are the pictures which I'm showing you, and we saw there was increase in footfall for children coming over there. This is before and after. And looking at what we had done, the other Gram Panchayats took up the thing and started refurbishing all the Anganwadis in the area. So now what we thought was, if we want to sustain this, who are the people? The local people should understand. So we went one step further, and as you know, Indian government has fantastic program, but there is no implementation. Indian government also realized that there are three people like AAA, the Anganwadi workers, the ASHA workers, and the nurse. In the nursing of this, they work in the same population in a different verticals. So they wanted to make them, integrate them. So we in Palghar district helped the government to implement this. So we got them together, and again these refurbished Anganwadis were the places we would call them, and the same program which government had given to them, we would teach them over and over, make sure they do the reporting in the right way. So that gave us a very good. So because of our good work which we did in this, we have a MOU signed with the Palghar district government for next 10 years, that whatever programs we do, they will give us all the support. And mostly we do community-based events because we feel it's just not just one person teaching just the school children. We integrate even the parents, the Gram Panchayat, make him understand what is the importance, why we are doing this. So community-based events are the main thing. Now, future journey for this is, as I told you, we are doing a Janani project. We are going to be for 5 years in one taluka, where we are going to find out malnutrition in pregnant women, follow them up throughout their pregnancy, and then newborns till the age of 2. Make sure they get immunized and their development milestones are good, and follow them age of 6 years in Anganwadis, preschool, where we will teach them, because that's the most important part of any child's life, that preschool education is very important. So next, our journey ahead in community health will be bringing education and health together. And I think if we integrate these two factors together, we will be doing that. Now, the jewel in our crown is actually Lifeline Express, which we are very well known for, and which we get very well funded by all the CSR activities. This is the world's first state-of-art multi-speciality hospital train, but which we call is Lifeline Express. Most of the people, wherever we go, they say it's a magic train. It serves rural communities which have no or limited access to specialized health services. And we are there from 1991, and we have conducted 214 projects, now 15 projects, with 22 states, and have reached millions of people and performed more than 460 operations on the board. And I'm going to show you how we do it, just few slides, and it's all pictorial, so I won't be taking a lot of time. Because of our success, we have inspired, and this has been replicated in Central Africa, China, Bangladesh, and Cambodia. The surgeons who come to work on our train, they call their surgeons dream train. So we have multiple. It's called Jeevan Rekha, Lifeline Express, Magic Train, and all kinds of names. So what we have to do, this remote places, we actually have to build some infrastructure. So we build infrastructure for registration and waiting area. As I told you, Avi, that we are integrating collecting of all the data through a platform, and we've created. So you see our people on the tab entering patients' data, so that the follow-up of these patients become very easy for us. So we have the data, hold the addresses, the Aadhaar card, so we know what we have done on that person at a click. And sitting here in Bombay, I can just click what is happening in that area at that day, even though I'm not there. I know that there are 500 cataract surgeries are done, 200 surgeries are done. So I can ask them why there is less or why there are more, what is the problem over there. If they have any problem, they can connect. I can see the data, all the things. So in the train, we have pre-operative waiting room. As you can see, these people are waiting for their cataract surgery. And we have a matron who looks after all the cleanliness and all. Then this is the operation theaters, which we have. These operation theaters have state-of-art equipments, and if they can be equivalent to any top hospital in India, we have a gynecological screening service for breast and cervical cancer, colposcope, and plus we have a mammogram. Our future is going to be.
I can't see the presentation. Is everybody seeing the presentation?
Yes, we can see it. Why don't you log out and log back in?
We can see it.
Yeah.
We can
So,
also.
so what we do, what we are going to do next 10 years now is that we are going to concentrate on oral cancer, breast cancer, and cervical cancer. And we already fully equipped infrastructure. We have a dental clinic where dentists come and work, and we take biopsies for the thing. This is how we have a microscope for performing cataract surgery. This is a pre and post operative, and this is a lady who's given us thumbs up for she can see and what is important. And this is a young girl who had hearing problem. We do surgery. We give hearing aids free. All this is done is free. We don't charge anything to the patient. And what is wonderful is that people just come in, they get diagnosed, and the operation is next day, and they're all right. Otherwise, they would have to walk at least go for 10 days away in a district hospital with no one to be there. Here, person can come, elderly person come alone and get operated. And here is a pediatric orthopedic service, which is really rendering, which we have these children having deformity because of cerebral palsy. We do pre-operative, post-operative. We give them aids and appliances. And
Dr. Chowgule, can I ask what happens with follow-up when
yes,
the train moves on?
No, what we have is we have a group. What we do wherever we go, we have 1 or 2 doctors, which are local doctors, who work with us, and then we ask them to follow up. And since we are collecting all the data now digitally, we can concentrate. Now, what we are going to do now is we are going to do when patient goes, when we go away, we are going to do telemedicine over there. So that person in WhatsApp, or we have a platform where he can show us that, look, I removed this plaster this way. This is the device we have put for him, and this is what is happening. So we can teach them about doing rehab and all those things. So this is how we are going to go forward now, because before we were going there, doing the work, and we were happy and leaving it to them, to local doctor. But what we do now is get 1 or 2 local doctors and say, look, come and work with us. So now we also work with the district government. Okay, so the district government also provide us the local doctors. So we are in touch with them. Our physicians and surgeons are in touch with those doctors. So if they have any problem, they can call them up immediately. Have I answered your question? So the cleft lip is another one which we work on. We don't do cleft palate because that requires much more follow-up, and there are more complications. And these are the 2 corrective surgeries in pediatric we do. And with the Tata Memorial, we had done only 1 oral cancer in 2016, but we realized that it required a lot of follow-up and all that. So we have discontinued doing. We only do detection of oral cancer. Then we have this education, like we do like on epilepsy, first responders or community, tell them what is epilepsy, what she should be doing. So doctors teach them. So this is all done in outdoors. As you can see, which is makeshift hospital things we have. We have e-registration. And this is one small story I would like to tell. This old gentleman came and thanked me. He said, and he was so happy that I took the photograph. He's saying, what you've done for me. I've seen, this is my grandchild. This is the first time I've seen my grandchild. And he was so happy to see his, these are the things, words, these are the words make us go again and again. We not only treat people, but we are inspiration to the locals. This young girl came and drew the train and came to me and said, can I have a photograph with you? Now, everybody likes selfie. And she said she wants to become a doctor. So we are inspiration to the local community. And this is a small boy. So these are the kind of places we see and treat. And this is another similar case. This was in West Bengal, and I don't know why we saw so many. So this is our team which works with us, and actually is their dedication which has taken us a long way. This is our train, and I would like all of you in Chicago join us for empowering our rural India. Thank you.
Excellent work, Dr. Rohini. Excellent work. Thank you very much for that.
Okay.
Great work.
So can I escape? How do I come back?
Just stop sharing in the bottom.
But
You
I
have
can't see exit.
the cross button in the bottom.
Yeah, I know, but it's not showing over here. Can I go out and come back and take questions or something? But I can take a question.
The red button,
The red button?
top left, yeah.
It's done. Oh, she left the meeting.
Oh, that was her out.
Yeah.
Okay, I'll get in touch with her and call her back again.
Yeah, that's fine. She's joining back.
Yeah.
Nice to see you back. Yeah. Yeah. So apart from Dr. Rohini, we can't hear you, but just my question, funding is obviously important, but a lot of us want to be slightly more involved in trying to understand the problem that you're facing and make a contribution based on that also. So can you, for example, because just to give my background, about 30 years back, I founded a company called the Idea Machine, a consulting company working with the Professor Virginia Tech, basically using computers for brainstorming and idea generation, and then went to a lot of other areas that I've done over the number of years. So can you explain for us what is the challenges that you're facing working in the field in such a complex environment, so that we can at least have a flavor of that and maybe just internally brainstorm to see how we can make some contribution?
We went for, as you see, 38 years. We went with no money, with little money, and now because of the CSR, lot of organizations want to help us with the money. Money is not that great a problem for us, as the train is a very emotive subject. Like they know the hospital going to the poorest of the poorest aspiration area. So we need to do 10, at least 10 Lifeline Express. So mostly we get to do those 10. But what our main thing is that, as Leela very rightly says, the follow-ups. They are ready to do us that project, taking the train to that place. But we need money now. What we have done because of COVID, we have started doing outreach program. Before the train comes there, we have a group of people where we take a volunteer, like an NGO, and tell them, let's go house to house and detect cataract patient, cleft lip patient, children with the thing. So we are preparing the patient before the train goes there. For that kind of a thing, and post-operatively, what they should be giving us, that's the two places we are finding difficulty in getting money for. But to run the train, do that project, people are very willing, we'll give it to you, but they are not willing to give us, to do outreach program. They're not willing to give us post-operative follow-up cares and all that. That's why, Leela, for a long time, we were struggling, though we are trying to get over it by using telemedicine, but it's not the same. I would rather have 2-3 people going back over there and seeing whether those people which we operated are really doing well, because I don't want to go to a place and do cataract because to cure blindness and create blindness on the top, so because of post-surgery, iatrogenic blindness. So that is where we are having problem. So that's why I have introduced this digitization of all the records. So at least I know who I've operated, what we have done, what is the need, so we can go back to them. So if at all there is some, I think your organization, India Development, can help us in those two areas, and otherwise where train is concerned, we are not all badly off. But where community health is concerned, not many people seem to think that it is important to have prevention. Prevention is most important thing. My idea is that in India, we all the time say our 2%, 3% GDP is spent on healthcare. But that 2% we are spending in the cities. We are not spending the 2% in the villages for prevention. If we could spend small amount, as Dr. Batra told you all, small amount in villages, and I'm sure, Leela, you must be knowing small amount spent in the villages. We don't need to spend big money. We can do much better. And I personally believe 90% of the people need prevention, keep them healthy. It's that 10% who's unhealthy, and we're spending all our GDP in that 10% of people. But instead of that 80%, 90%, let's make it 95%. Keep them healthy for longer time, and we won't have to spend that kind of money. Also, we have infrastructure, but there is no infrastructure for diagnosis, for detecting of a disease or giving treatment. Those part is not there. We have brick and stone structure everywhere in the villages, primary health center, but it's not equipped, so it doesn't help. So I think if this India Development can help us in the villages rather than the train, because train is now long-term. People are very, very emotive in India. When they hear about the train, they say, okay, here. In fact, we are booked for next 1.5 years. So for programs, but we need other things if we want to do good quality work.
You said that so well. My dad always says, I think I'm forgetting who the quote is from, but prevention is always celebrated in principle, but never in practice. And
exactly.
Always ends up being the same problem.
Exactly.
I don't want to interrupt. I just really quickly, the people that you're training to do the teaching, is it midwives or a separate group of healthcare workers? Because we want to do the similar thing in Andhra, or at least around our hospital, because we're trying to prevent prematurity to prevent retinopathy of prematurity.
Exactly.
And we have to do the same kind of training down there as well.
What we find is we've gone through different things. We did with midwives, then we try to do ASHA workers. What we found is that doesn't create, till you're there hand-holding them, they work. As soon as you leave that area, they don't work. So what we have started doing is we have our own community health workers. And now with this COVID thing, as I explained to you, what we did was, it was one of our ex-trustee who said, why don't we take college students? There are a lot of college students who don't have any job. They have college 9 to 11. Afterwards, they are free. So what we give them a nominal amount of like 2,000 per month and say, come on, I will teach you on diabetes, we'll teach you on hypertension, we'll teach you. So we give them the, how to measure oximetry, saturation. We give them a machine for measuring thing. We teach them how to do it. So we do workshops with them. And we find they are much brighter and better than any ASHA workers, government workers, because they are motivated. And then we kind of give them a certificate saying that, they are COVID warriors, they are, they impact India's, like Yashodas or something like that. We keep a name and giving them certificates. So that's how we are going to do that with this. With this COVID, we learned that taking young, educated children, like especially college students, has done better. We have done better work in 2.5 months time I've already covered up 1 lakh people with them, and I'm analyzing the data on what we are seeing and all those things. How many are diabetic? How many are hypertension? Who had COVID? What is happening to them? And there's very remarkable thing. They have entered everything so nicely. Hemoglobin, to measuring of the hemoglobin. Now we are going to teach them what is the importance of nutrition in pregnant women, and then we are going to say, you go and tell your sisters, your neighbors, your everybody, teach them. So that is, I think that is a better way, Leela, to do it at a low cost. If you need any help, we will very willing to give you. What we've done in West Bengal also, we've created a software for these people to write. Every time they do follow up, they have to take weight, blood pressure, and all that. So we have a software for that, which the West Bengal people are copying the same thing. We've given them, you do it also, kind of stuff.
Thank you very much, Dr. Chowgule. And
Thank you for inviting Mr. Mohan. It was
excellent
great.
presentation. The idea of IDSA is bringing people together, collaborate,
Yes.
learn from each other, and help each other.
Absolutely.
So we will work with you, and we have other contacts, healthcare area, many parts of
Yes.
India, and
Yes.
we would like to see that whatever things you need in different areas, if we can have somebody collaborate with you to help them serve. Okay.
Sure.
Also,
Sure. Thank you.
we have company here, working with a company here who has this healthcare kiosk, which can do a
Okay.
lot of things on the ground, preventive way, checking
Uh-huh.
blood pressure, this and that, all kind of so many functions. Okay,
Mm-hmm.
I can share information about that. Those are
Sure.
the things we can install in the villages, provide job to these young people who can coordinate
Absolutely.
and run these things and help people on there, and then you connect with the physicians in the city with the basic information about these people. Okay.
Absolutely, Mr. Mohan. What you said was right. Instead of trying to get these educated people in the city and make them live in the slum, they rather be there in their own home and doing good work. And if we can give them employment there, they will be happy to stay there and not stay in
I
the
think that's the model
company.
we have
Yeah.
to follow it to bringing people from outside. It's very
Yes.
temporary. Even people are posted. Doctors don't go in the villages. They send
Absolutely.
somebody else. So they will send hire a nurse and send her
Yes.
instead of that. So a lot of things going on. Them getting big salaries. Still, they don't want to go and work villages. Now I grew up
Yes.
in a village, but I've been out from the village long time. I go there every time I'm in India. It has become now a bigger town. It's not a
Yes.
more village, but still there is a facility and commitment of the healthcare or any other professional is not there, and that's why we as NGOs have to supplement all these things to wake them
Yes.
up, try to make them work, take care of the problems. And
Absolutely.
I'm glad you are doing this thing, and we will like to be with you as much as we
Yes.
can.
Anytime anybody needs help
Yeah,
in
and
any,
we'll connect with your funding,
we will
also other things,
definitely.
but
Yes.
our main strength is that we are contacts. I've been doing last now 18, 19 years, and
Mm-hmm.
so that know people around the country. We have done many conferences in India, also different parts of India. So we have
Yes.
developed a lot of contacts, and we'll try to form a healthcare group so people can discuss things and talk and share the things more regular basis and share their problems, because the problem you are having, somebody might already have solutions. Okay.
Yes. Yes.
So,
Absolutely.
so
Thank you very much, sir.
all right.
Thank
Thank
you.
you, and
Thank you, everybody.
yeah, thank you, and please stay on and
Yes, I
hear
will.
the realizes and there.
I want to hear Leela tell me
Yeah,
something, because
and I have something.
I is a very important thing. Last project we did 800 cataract surgeries, which was the largest, you know. Okay. Thank you.
Yeah.
Yeah, thank you, and I will see you then later on. Yeah.
Yes.
Yeah. So before I ask Leela to start with the presentation, just my thoughts that we have NGOs working in different area, education, like healthcare, other things. Why should we every area have an NGO coordination committee or something, so that these NGOs have everybody have their strength, and they can have referral systems to integrate with others, I guess, right? So some kind of a total coordination committee or whatever it is, just informal or formal kind of a way, that all the NGOs in that specific area get together and pool their resources and their strength and leverage
Absolutely.
each other's strength. So maybe that could be a idea that we can think about trying to support and do that. What do you think about that? Will it work, or
Absolutely. I think we all should, there are so many times in small area, there are other NGOs doing identical thing. Like in West Bengal, I'm giving them my software. They're doing absolutely identical thing on pregnant women. And okay, there are small changes which I've done because I have a software company. I've done some small changes for them. But if we can coordinate and instead of replicating and trying to start from the beginning, it's better that if I have start in a midway and somebody else has done the first part, so I can go ahead faster. Now for the train, we can, Impact India can give anybody advice on, we can have 4 more trains. In fact, we are trying to go and talk to the Prime Minister and tell him, just as he brought banks to the villages, we want him to bring the hospital to the villages by train. And that's the idea which we are trying to work on now, next few years. Like, why not take that hospital? And it is needed. That is the most needed thing. Wherever we have gone, we get at least 1,500 people per day visiting us. That's the minimum. And sometimes sometimes we just can't manage the crowd. Sometimes it's like, especially Bihar and Northeast areas, there are just people are saying, operate me. And we say, no, you're traumatic, we can't operate. They get upset that we are not doing that, Traumatic cataract. We cannot operate traumatic cataract. So we have to explain to them. There's no awareness, because suddenly they find the neighbor's vision has come and why are you not operating on me? So these are the small things we have to deal with. But I think we need more trains.
thank you, Pat. So before we call, I'll just share Dr. Leela's background, and then maybe she can get started. So give me 1 second, please. So we have Dr. Leela Raju. I think her father is well known to all of us. So it's good to see a younger generation stepping in, taking care of this issue. So before further ado, Leela, why don't you talk about your own personal journey and then get to the specific area that you want to talk about that. Okay, I'll stop sharing.
Sure. Thank you. I appreciate the chance to represent both the Eye Foundation of America and our group. Hopefully this will work okay.
Yeah, we can see it now.
It's okay? I think probably I needed to go the other way. Let me try one more time. Okay. Everyone can see the talk? Oh, no.
Yeah, we can.
You can.
Just make
Yes,
it
we can.
presentation mode, if you don't mind,
Yeah.
at the bottom. Yeah.
There you go. Okay, so I'm a associate professor at NYU in New York City, and I was lucky enough to be able to see my dad work when I was very young. We used to go to India with him every time he went, and I think actually the first time I saw him operate was in India. But I think we've already discussed how much the vision is important, and obviously when you can get to it when someone is younger and a child, you're going to avoid the inability of the brain to make a good connection with the eyes, and that's why have a strong focus on children's vision. My dad started the works in eye camps in 1977, and please let me know if you guys can't see the slides. Hopefully they're forwarding. And because of the restrictions to import modern instruments, he started the foundation in 79. Of course, things are a lot easier now. There are some great photos of him having to almost do surgery with someone holding a flashlight because they didn't have a microscope or the power went out in whatever building they had created as a makeshift eye hospital. And once again, we've talked about this already today, how so many things affect the whole family, and it tends to be a cycle. And blindness in a child, like the story that Dr. Batra gave us earlier, I mean, affects not just the child, it's the person, the whole family, and then the society around them. And combating childhood blindness has been identified by World Bank as the most cost-effective of health interventions. So we have two institutes in Andhra Pradesh. One is in Kakinada and one is Rajahmundry. Rajahmundry one is where we focus most of our time when we go. I'm a cornea specialist as well, so I do a lot of teaching when I go there, as well as helping develop our programs in other countries, especially Ghana, which I've been to several times, working with doctors that we have met through Rotary and other organizations. These are some of the images of the two institutions. And we've seen about 2 million plus, it's actually 3 million plus now, I think, outpatients, over 300,000 surgeries, a large number of them in children. And as I mentioned before, it's all about not just going there and doing the surgeries yourself, but also training those around you to be able to follow up and also help screen for the future.
Dr. Leela, we can't see the slide move forward.
You haven't been moving. You have
They
to
haven't? Okay. Let me see what's going on.
We didn't see the torch one.
Oh, okay. Let's try this again.
I think just you have to do the click on up and down click.
Yeah, no, I was forwarding it. I don't think it's because I couldn't see can you see everybody's faces when you're sharing your screen, or no? Just your own. You can't. Okay, then it's not. Let's try the entire screen again.
When you're doing full screen, then you can't see other people.
Oh, you can't?
Yeah.
It's not gonna work. So you opened your talk, right? You went back and shared it, right?
Shared it, yeah. And click on the top. You did well the first time. You could see your first slide, but you couldn't see you moving forward.
Yeah, I'm not sure why it didn't.
Open a window. Okay.
Yes,
Now
okay.
Now it's coming in. So you have to go in the presentation. And
I did that, and then it didn't forward.
Then you advance that with the arrow, up and down arrow.
Did it advance?
No, it didn't advance.
Yeah, I'm doing exactly that. So I'm just going to do it here. How about this? You can see it advance now?
Yeah.
Yes.
All right, that's fine. No worries. We'll just do it here. So I was just saying here, this was the picture that I was talking about here. This was the microscope he had at the time, but we have other images where they were literally holding a flashlight. So we talked about, the World Bank saying it's the most cost-effective of health interventions. And these are the images of the hospitals. And I was talking about being able to train the necessary personnel and doctors, not necessarily just do the surgeries yourself. So, and 80% of our learning is through vision, which you don't think about it until you can't do it most of the time. So it's all about education and preventing this from causing problems in the future. Exchange programs have been a big part of what we've also done. It is a cliche in the United States, but they always say you can either, you give a man a fish, he eats for a day. You teach a man to fish, he eats for life. So the idea that you have to not only go in and just do the work, but the education aspect of it can't be you can't ignore it. So the future, we're hoping to build a green eye hospital, which will have a specific focus on with a children's wing. We actually are in the process of starting construction at this point. And the goal is to make it one of the true tertiary care centers, because as we've mentioned, a lot of those happen to be in bigger cities, and to be able to do that in something that's maybe a little bit more accessible, even though there's still going to be transportation issues regardless of where you are in India. But this would make it more easy for more patients to reach us. And it's one of my dad's favorite quotes. There can be no keener revelation of a society's soul than in the way they treat its children, from Nelson Mandela. And when these programs that we've already heard about today are so great in that the focus in these on teenage girls in India is remarkable, because you stop things like giving them MMR vaccines in that age group. Rubella is a huge cause of congenital cataracts. And if you can make sure they don't get rubella in the first place and are able to pass it on. Anemia, another reason for prematurity. The big program we've been working on is trying to reduce retinopathy of prematurity, essentially because the child is born prematurely, they need to be in an incubator. And then because of the amount of oxygen that the eye gets, unfortunately, it thinks that it's done developing. The back of our eyes actually develop even after the child is born. So you need to be able to put the right amount of oxygen around the baby. Otherwise, the eye thinks it's done. And then all of a sudden, it's out of the incubator. It's not getting the same amount of oxygen, and blood vessels grow in the back of the eye. And anytime new blood vessels grow in the body, they don't do what they're supposed to. They tend to bleed, and they can lead to a retinal detachment. And that is, we only the back of our eye is not something we can replace. We haven't gotten to that level of technology yet. You can think of it like brain tissue. So you have to make sure that you are either treating those children very early, which requires a lot of screening and getting the children to a retina specialist. But if we could avoid prematurity to begin with, then we're really hitting that problem way ahead of time and hopefully avoid needing treatment at all. So if you look at the data, this is, I think, a little bit older data too. Hopefully it's a little bit lower at this point, but under 5 years, 48% are stunted, 19% actually meet the definition of wasted, and 70% are anemic. So what our hope is that, and this is why I've been asking so many questions of our other speakers, is that we want to do a program in conjunction with Dr. Lekha Hota, who is a urogynecologist and also a master's in public health, regarding antenatal care around the hospital area in Rajahmundry, where we can, by doing better education, increasing the number of visits for antenatal care. We found that there's very low. And then this teaching, which sounds like, I love the idea of the college students doing it, because there are colleges in the surrounding area that we could really expand the base of who knows, the knowledge base for everyone in that area. And it's amazing what kind of photos we can take with mobile phones. And I was going to suggest that might be something to help with some of the eye follow-ups from the other projects, if you can't actually get in to see them. But with the kind of cameras we have and the way to interact through a phone, while a lot of people may not necessarily have the best housing, but they'll still have a cell phone. And if you can use that to interact with people to help educate them, then hopefully you will be able to, once again, educate so that we avoid problems in the future. And I totally agree with you that a smile is worth 1,000 words. And this young kid has the glasses this thick because he had cataract surgery as a toddler. And so until he gets implants placed, he will have thick glasses, but he can actually see now, and he wasn't able to before. Okay. I hope all those slides showed that time.
Can I ask you something, Leela?
Please do.
We have a lot of eye surgeons now who are not so willing to come. And so we need to get good quality eye surgeon, because as I told you, when we go for screening, I don't want to create blindness to them, whatever little vision they have, by doing surgery. So is there some way we can collaborate together, and you can identify some good surgeons for us to come and operate on our thing? We normally give them their travel, stay, and we can give a small, like honorarium for them. Because what we find,
I think we can definitely help you identify.
Because what I find in India is, before we used to get them free, Now, what I'm finding is all the eye surgeons are asking a huge amount, and then our budget goes out of way, and we can't then afford to pay them so huge amount and not to get good quality eye surgeon. How we can screen them that this guy is good, this guy is not good. That is our problem. When sometimes we find one or two surgeons coming, and then we find they're not doing so very, very sweetly. We tell them, you just do one case under supervision and things like that.
Right.
But
I'll tell you what, I want to come operate on that train. So I'm going to tell you next time I'm in India.
You're welcome. Absolutely. Yeah. You'll enjoy it. You know, it's really, we do 100 cataracts per day.
Yeah. So yeah, to be able to do surgery without limitations of a lot of the rules that we have to do in India, in the United States is a different matter.
We have a microscope, so our train is well equipped. You know, it will be as par with the Bombay Hospital in Bombay. So you'll have, and we have a matron who has been trained, who has been worked in 40 years in Bombay Hospital. So you know, infections control is one of our major thing. We take care absolutely. We don't have any infection happening in our train.
And I have some thoughts about how I could, you know, there's certain things that we can implement to even reduce your risk regardless of who's doing the surgery. But yes, I would love to talk to you about that at another time. Offline.
That's great. That's great.
So any more questions? You done with that, Dr. Leela?
Yeah, I'm all set.
Okay, great. Anybody, any questions for Dr. Leela?
I want to ask her, you said you're building a hospital, green hospital. What exactly is the concept? What exactly different are you going to do there?
So, you know, obviously the building anything at this point, if you're not thinking of sustainability, I think it makes it very difficult. We've been in smaller locations before that don't have quite the space to say grow into the more the research or education aspects. We're going to hopefully be doing more teaching of doctors in India in the near future. So this would allow us to have the space to do that. And then by green hospital, as you can imagine, we're going to have a green roof, probably be on a microgrid so that it's self-sustaining. You're not, you know, the abundance of solar energy in southern India is nothing to be ignored. So hopefully all of these will work together to make it something that's one, sustainable, two, then you make it easier for yourself to make sure all the monies that are coming in are going specifically to care and not always capital costs. So if you can really say, all of our board is volunteer, so none of us take anything for doing what we're doing. So everybody's kind of doing it on their own time. But we try to, I mean, I love that 1 to 72. I'd love to figure out what ours is, but being able to say that every single dollar that's going in is going to a project is our main goal. And that would be one way to do that.
Yeah, that's what we try to do. Less than 5% we try to spend on our infrastructure. Rest all we want to spend on patients. That's what is important. Lovely, Boka. Hope we'll be in touch.
Absolutely.
Any other questions? Dr. Krishna, are you ready with your presentation?
Can you just give me, I want to show something related to the subject of the eyes, work being done by our member Trees for Life, and they have developed some classes for children to be used in India and anywhere in the world, very cheap one. So I want to show, they just send me the video, just about 5 minutes, and then if it is okay with everybody, okay?
Yes, okay.
Yeah.
Krishan, you're on 3 screens.
Yeah. Where is my mate gone? Just coming, huh? Okay.
We can say Dr. Mohan.
Yeah. Should be coming now. It's on.
On behalf of our team in Wichita here, we want to thank the team in Madurai that has taken so much pain and effort to produce these lens glasses frames. And we are going to open it. And we hope that these glasses, as they come in production, and they will serve millions of children for I don't know how many years. This is just the start. And we dedicate it to all the people at Madurai who were involved in making this happen. And this is our thank you to them. Linda, would you do the honors, please?
I guess since I'm the
Yeah,
surgeon.
she is the surgeon, yeah.
That's right.
Linda is an eye surgeon here for children, and it was her idea that started these classes.
Okay,
First,
let's see.
might be some-
Wow. This is. Goodness. The baby glasses.
These are the glasses, and these sell for around $300 to $400 in the United States. And these will be now made available to children in India, approximately $3 to $5 a piece, so 10 times less. No, 100 times less, almost 100 times less than what they are available. And these are flexible, and the lenses would be such that they will not hurt. They are made of special material.
They have a strap on the back so that it stays on the baby's head. And
Very flexible, isn't it?
the lenses actually pop out.
Oh. Oh, I
They're
know.
meant to pop out.
Yeah, so it's easy to change the prescriptions and keep the frames.
Oh.
So that's why we could make lenses and then be able to pop them back in. Yeah.
The lenses that they're going to make at Aerolab are, I've been told there are two types of cuts you guys have to make. So one will be already there. So they'll come pre-done that way.
The older children have glasses available there in India that are already good quality and good price, but it's just the small children who really, we were directing this towards, because they're the ones who really didn't have available the glasses. So these would be for babies. Wow, it's pretty nice. Yeah, they look great. Well, thank
Well,
you.
it is great to see them after all these
I
2
know.
years.
Yeah,
That's something.
wow, that's, what a joy to see it come to fruition.
Mhm.
He already hates it. Christian. Open your eyes, buddy. Hi. Hi. Hi.
Hi, Munchkin.
You like them? It's your first time trying them on.
Hi, baby girl. You like him? Can you see Mama? Is that a whole new world for you?
Thank you.
You're very welcome. Can you see now?
That's great. I was to say, Oral Lab makes really great products. They've done an amazing job helping distribute both intraocular implants. So that's what we put in the eye after cataracts are removed. They've made other things like a partially artificial cornea. So they've done great stuff already. I love the idea that you can pop the lenses out, because as a child grows, the prescription changes. And that's always been, I think, the biggest trouble is like going back and getting a new prescription and having to get whole new frames. But that's an ingenious idea. So that would be very helpful to a lot of children. I forgot to mention, I wanted to say this regarding our follow-up. We do a lot of screenings for cataract surgery where we go out into communities and look for cataracts. A lot of people have stopped doing those screenings as much.
Yes.
And we're finding much worse cataracts now than we used to. I'm sure COVID made it very difficult during that time, because of the screens. But even before that, that was happening. We actually send people back out to those those communities at that 1 month time to check on how they're doing, because cataract still is the most common reason for poor vision. But
Yes.
it's all about trying to catch any of those early. For children, it has to be catching it early, because if you don't get it early, the brain, like I said, won't develop that connection. It's a little different from an adult cataract. I just wanted to add that.
So Leela, you send them after 1 month, not after 3 weeks.
3 weeks to a month. It's around the same time. Your
Right.
biggest risk is in those 5 to 10 days, or 2 to 10 days after surgery, because
Yes.
that's our greatest risk for infection. But after
Yes.
that 1 month visit is really making sure that they have whatever kind of glasses they need to help the vision be, and make sure there's no late stage issues, mainly from diabetes.
Yes.
But all that stuff, yeah, it's usually that first few
but-
days after surgery, and then a few weeks or 4
So
weeks.
that's why we do we stay, the train, I forgot to tell you all, the train stays at one place for 21 days. So we do cataract first, the eye first. So we are there to follow up on the train. The people can come if they have any complications and things like that. So we
That's
are there
perfect.
for 21 days for the train to be there. And we have physicians and all, everything. We have the network. So the USP of our train is we being there for 21 days. So that's why we are going to do HPV vaccine. If India development wants to help us, HPV vaccine in young girls, school-going children, is the preventive for cervical cancer, and we want to take that issue on preventing of cervical cancer by vaccination. So we can talk about that next time.
Thank you very much. And so now we'll be doing the speakers we had before you, and they showed up not early enough to start the program. So I think Avi will take over, Mr. Khanna, and
Yeah.
then
Sure.
Dr. Anil Mehta.
Yeah, sure.
Okay. Yeah.
Let me start with the background of Dr. Khanna, and then we can go from there.
Yeah.
So this is the brief bio of Dr. Khanna that I have here. I would not talk too much about that. I think Dr. Khanna should talk about, like others talked about, their journey and what he wants to cover today. So Dr. Khanna, please go ahead and take over. Thank you.
You are on a mute.
Okay, can you hear me now?
Yes, yes.
Okay, I'll just give you a little background. You see, I've done 30 years of business and management. I've lived and worked 7 years in Germany and Japan. My second language is German. And last 30 years, I'm in the social sector. I passed out, I'm an engineer by profession. I passed out from IIT Kharagpur exactly 60 years ago. Now, my having lived and worked in Germany and Japan for 7 years had a very big influence on my thought process. Besides that, I've done 13 joint ventures with 13 other countries in the world. So I've traveled to a lot of countries, including the US, Europe, Japan, and many other countries. So all these business ventures left a very deep impression on my mind because, as you know, India is still very poor in terms of poverty, in terms of healthcare, in terms of employment, in terms of many other issues. We are very far behind. This evening, I'm going to concentrate only on the area of vocational training, skills development, and employment. Because if you talk to any politician, the first thing he wants to know is how to improve the employment of his state or district or his area. That wasn't easy for me because just to bring you up to date, what I have done is that I have not made any PowerPoint because this is a very complex subject and also as of today not fully understood. So I have given to Mohan 18 articles on skill development and employment, which I have requested him that whoever is interested, please share those articles with whichever audience is interested. The reason is PowerPoints come and go in a small flash in a 15-20 minute presentation, and the retention rate is very, very poor based on my own experience. So I thought instead of just flashing a lot of PowerPoints, which of course is a very good way to make a presentation, nothing against it, but the retention being low, I took the liberty of giving actual research papers as well as suggestions and solutions for improving employment. Our focus is only on India. We only work in India. We don't work outside India. The main focus of our area of skill building came about a long time ago when I was working in business and industry. And I'll just give you one example. My last job, I was the president of an Indo-American company in Bombay. And I was given this post at a very young age of 37. I was only 37 years old when I became the president of this company. We were only doing about $2 million turnover per day, per year. And in 12 years, I took it to $100 million. And I was asked by the bankers when I was leaving after 12 years, what was the secret? How did I increase the business from 2 million to 100 million in 12 years? And I said, it is vocational training and skill development. He said, what do you mean? I said, we skilled all our employees right from the chowkidar who opens the gate. Chowkidar is the gatekeeper who opens the gate for customers to come into the factory or the office, to the telephone operator, and then we moved up. The managers were the last to be trained. Now that became a case study with ICICI because the then chairman, Mr. Wagul, he was quite surprised. He said, "How much are you spending on training every month?" I said, "I spend 1 month's salary per year on training every year." So that was a real life experiment. But I want to just give another two very important episodes which happened during the course of my journey in business. Was in 2007, I was invited by the government of South Korea and the Ministry of Education of South Korea to chair a session and moderate a session on vocational training for developing countries. And there we had about 1,200 people from 50 countries. And the inauguration was done by the Deputy Prime Minister of South Korea. I was quite surprised. In fact, I went to meet him. I said, "Sir, it's really nice to see the Deputy Prime Minister of the country inaugurating a HR conference." He says, "Well, do you know, my job as a Deputy Prime Minister is only to look after human resources. My job is only to look after human resources. And we spend up to 25% of our GDP per year on education and skill building." So that was the first thing which really comforted my thinking process, because that is the path which our think tank and foundation, which was set up in 1992, that was the path we were taking. We were concentrating on human resource development, education on one side, skill building on the other side. The other big impact which I was to observe and to experience was a few years later when Professor C.K. Prahlad was requested by the CII and the Boston Consulting Group to give a presentation to us in India as to what should India be by the year 2022. That means next year, when we were celebrating 75 years of our independence. This we asked him when in 1960 we were celebrating in New York 60 years of our independence. So that is when we asked him to give us an idea as to where and how we could really grow and prosper when we were celebrating 75 years of our independence. Now, it was very, very surprising for all the committee members and the stalwarts in CII when they listened to Professor C.K. Prahlad. He said, "If you really want India to prosper by the year 2022, you should concentrate on education, you should concentrate on skill building and on the youth." Now, you know, CII had about 76 national committees on finance, on corporate tax, on banking, on so many other issues. He says they can never make a change in this country. The only committees which will make a change are these three. Now, I just happened to be on the national committees of CII at that time on education and skills. And it is by default that I met Professor C.K. Prahlad, and he was very happy to see that the way our foundation and think tank was working was on the same lines. So these two experiences really reinforced our thought process and also gave us encouragement that we were on the right path. I do not know how many of you in India know that education itself was neglected in India. It's only during the tenure of Atal Bihari Vajpayee in 2000-2004 that for the first time in the history of India, education became an important national subject. Actually, Atalji read out in the parliament the Constitution of India, where he said that the right of education is very much enshrined in our constitution, but we don't take it seriously. I had a lot of intervention with a lot of members of parliament at that time. And I can tell you that most of the MPs who were running the country before the BJP, they thought education was not a good idea, because they said if the people of India get educated, we will lose our vote bank. And if we lose our vote bank, we will be thrown out of politics. But Atalji took it very seriously, and he brought in what is known as Sarva Shiksha Abhiyan, that every child of the age of 14 and above must be in school. And the state governments, of course, were not very interested. And the government of India at that time said, okay, we will pay 2/3 of the cost for education. You pay at least 1/3. So it's only in 2000, 2004, nearly 50 plus years after our independence, that education and school dropout and children roaming around the streets of India became a thing of the past. Now, this moved on. And of course, we, our think tank and foundation has got two distinct divisions. One is the think tank, where we work on various research projects, skill building being one of them. There are many other subjects. And our foundation does actual social projects on the ground. But I thought, being a small organization, if we can make a big policy change in the center, we would have done something which even the big chambers of commerce have not been able to accomplish. But we were able to make a very big change in 2004 with Atalji, which was in the area of micro, small, medium enterprises, which we brought in that ministry in 2004 and 5. But we kept on lobbying for skill building. And sometime in March 2014, just before the elections, Mr. Suresh Prabhu, who was a minister with the earlier BJP NDA government, he arranged a meeting for me to meet the Prime Minister designate, Mr. Narendra Modi, in Delhi for a few seconds. It was hardly a very short meeting. And I do not know how many of you know, but in our foundation and think tank, all our publications are in 12 Indian languages plus English. The reason is English penetration is hardly 6-7%. So I handed over my handbook in which we write all the suggestions and solutions for the country. And I handed it over to Narendra Modi with a request asking him, sir, when can we talk about or have skill building as an important aspect in this country? I said, China has 5 lakh skill centers. Japan has 1.5 lakh skill centers. Germany has 1 lakh skill centers. India has only 5,000 skill centers. But India has 60,000 colleges. We are busy giving degrees to the youth, which is of no use. They can't even make a cup of tea. We said, yes, I know. I have seen your handbooks earlier. And I can assure you that if we come to power, we will start a Ministry of Skill Development and Entrepreneurship. Why I'm saying entrepreneurship? Because 60% of the workforce of India is self-employed. And by the grace of God and by the concentrated effort of Shri Narendra Modi ji, in November 2014, the Ministry of Skill Development and Entrepreneurship started for the first time in India, 67 years after the independence of this country. So we were very happy because our work for 15-20 years had paid off dividends. We have never thought that as an organization we will do everything. We thought that if we can make some big policy changes in the center, because as you know, education is a state subject. But if a policy is made at the center, it will flow down to the states, to the districts, to the talukas and the blocks. It may take time, but it will happen. Something which is much beyond the capability of a small organization like ours. But the work was not fully implemented because there were a lot of issues on education which have to dovetail in skill building and employment. The good news is that we kept on working with the central government even after 2014. And I'm happy to tell the audience here, and especially to my friend Mohan, that in 2020 July, the new education policy was announced by the government of India. Nearly, I would say, 73 years after the independence of this country. The good thing about the education policy is that it dovetails skill building and employment for the youth right from the age of 14 onwards. This was missing earlier. The other two, three big changes which have come in the education policy, which will have a big impact on employment as well as the growth of our nation, is that pre-primary education, because I heard a lot of medical experts on healthcare, but I did not hear anybody mention that 90% of the human brain is developed by the age of 6. And in our education system, this was missing till 2020. Now, for the first time in India, children between the age of 2 to 6 have to attend what is known as pre-primary school, which was missing in India. They call it kindergarten in other parts of India, other parts of the world. The other good thing which has happened, that in the new education policy, they have not only dovetailed skill building after the age of 14, after class 8, but they have allowed the youth to pursue their higher education in their mother tongue. That means you can be a doctor, and if you are from Tamil Nadu, you can continue to study in Tamil. If you are in Punjab, you can continue to study in Gurmukhi. Or if you are from Bengal, you can continue to study in Bengali. Because I had raised these questions with Modi ji, having lived in Germany and Japan. I said, sir, they do everything in their national language. English is not our language. We were forced to learn English because of the British. We were forced to do English education if we wanted to go to IIT. But why an engineer must learn only English? If he's good in Punjabi, from Punjab, why can't he do engineering in Punjabi? And that has happened for the first time in our country. Because I can tell you, youth of our country who could not speak English, they were looked down upon by the so-called educated society of India. I don't think they are educated, because if they have run down their own mother tongue, I don't think they were very educated in the first place. So these are the few changes which have happened, and I am happy to say that now there is a big thrust on skill building, and it has to really go down to the state level. I will give you one or two very important examples. We work in a big way with agriculture. We work with more than 15,000-20,000 villages in India. We work with about 20 lakh villagers, and we work on rural development. So one of the things, we work directly with Niti Aayog, because the policy on these issues is decided either by the Ministry of Agriculture or by Niti Aayog. So we lobbied with Niti Aayog and Ministry of Agriculture. We said, in China, I mean, this is something that they were shocked when we gave them the information. I said, China's food grain production is double of India. They do about 620 million tons. We are struggling at 300 million tons. The very sad part is that the land which is used for agriculture in China is 20% smaller than India. So on a smaller arable land, they produce double the amount of food grains. And what is the reason? The reason is very simple: vocational training. China has 3.5 lakh vocational training centers in rural China. How many does India have? 650. We have 650 Krishi Vigyan Kendras, 650, for 736 districts of India, while China has 3.5 lakh vocational training centers in China. So what a Chinese farmer grows in 1 acre, our farmer requires nearly 3 acres of land. So I mean, I can give you a lot of examples, but the good point is this, that all our recommendations to the government are based on research. They are not based on hearsay. We gave them the research. I gave them a lot of information in Mandarin, which I had collected over my overseas trips in the last 30 years. And they were shocked. I said, sir, how can a farmer in India ever become a big rich man? He will always be poor. His productivity is so low. And then, of course, we gave some other suggestions besides skill building in farming. And in fact, all our recommendations have been accepted by the government and all have been implemented in the last 5 years. All of them have been implemented very quickly, I would say, because you see, we are giving free advice. We work free for the government of India for the last 30 years. We don't charge single rupee. And in fact, in many years, I have made up to 45 trips to Delhi from Bombay. I am Bombay based, and it has worked. Now, coming back to vocational training, I would like to just show the audience our handbook. It is called Transforming India, and we publish all our recommendations in this handbook. The back cover, you'll see all the language editions. We have 13 language editions, and the reason is this: we decided a long time ago that we cannot do the work of the government. So we work with about 25 different organizations. I will just give you one example. In the field of education, we work with an organization called Next, who have 3,000 employees, and we have done with them 100,000 schools, 100,000 schools, digital school education. They have the power to go to even 5 lakh, 10 lakh, 20 lakh schools if somebody can pay for it. We only work with, because you see, we decided that if we try to do everything, we will fail. Being a management guy and having run companies, I know our limitation. So we have combined our intelligence, our research, our work with 24 commercial organizations. Each one of them are specialized in some area: rural development, healthcare. We work with people who are very big in telemedicine. So like that, because implementation on the ground, I did hear some speakers talking of problems in Northeast and all. We have no problem because our partners work all over India. They work in all the 36 states and union territories of India. We can't go there on our own. We are not project people, but we do something which others cannot do. We prepare the information, we try to get the funding, we try, but implementation on the ground is done by our partners. We do not have a project team, although I have 24 people, professionals in my organization. We do not actually implement the project, but we audit the project, we check if the quality is good, and we do things like that. But we don't try to, we try to change the mindset of the people. Like Rohini Chowgule, Dr. Rohini Chowgule was very correctly saying that, it's the mindset of the people to change is very difficult. So we do that part of the work, but actual implementation is done by the actual project people. Now, I don't want to bore you with more and more information. I will just say that in case any one of you have any questions, my email ID is Krishan Khanna, one word, .iit@gmail.com. If any one of you is interested in vocational training or education or other areas, I can send you a list of articles and research papers which you can share with your team, and we have it in all the Indian languages. The reason is English, as I said, is only 6% of our work. For example, recently in one of the districts of Maharashtra, the district collector ordered 2,000 copies of our handbook in Marathi. He was so thrilled. He says, no NGO gives us material in our local languages. Same thing, we gave material in Telangana and Andhra and Telugu. In Gujarat, we gave in Gujarati. Like that, So the readership is very intense and the feedback is very positive because you see, they read in their mother tongue. Hindi belt, as you know, what we have done recently in all the Hindi speaking states of India, we've sent our handbook. Is called Bharat Ka Kaya Kalp. Mohan has seen my earlier editions of Hindi. I had donated 400 copies to his NGO in Jaipur many years ago. I have sent it to all the ministers of all these state governments, the Hindi belt. I have sent it to all the MPs, because they are the guys on the ground, they are looking for information which will help them to execute and implement good projects. We never criticize the central government. We never criticize the state government. We only give positive solutions. Criticism doesn't help. We don't try to be extra smart. We have limited knowledge. We have limited experience. So we just try to confine ourselves to whatever little we know. So with that, I'd like to end. In case you have any questions, I'd be happy. Otherwise, you can always get in touch with me anytime you wish, even after today. Thank you very much, Mohan, and thank you for giving me this opportunity. I'm sorry I could not come on time, log on time, because I had some people who had come to visit us in the evening, and I did not want to combine this with them. But all I can tell you is that we have been very, very successful by the grace of God by making changes in New Delhi. In the last 30 years, I must have made more than 4,000 visits to New Delhi. And we have not only implemented 2 central government ministries, I mean, something which even no Chamber of Commerce in India has done. But the Chambers of Commerce in India are like political parties. They don't talk to each other. CII will not talk to FICCI, FICCI will not talk to ASSOCHAM will not talk to PhD Chamber of Commerce, IMC will not talk to Bombay Chamber, and so on, So we have been able to not only create 2 ministries in the center, but also our suggestions on agriculture have been accepted and implemented. And also 1 or 2 other suggestions which we have talked to the government and which we are working with them are being implemented. But coming back to skill building and vocational training, I'm very happy to say that the government has done it not only by starting the ministry, but has dovetailed it into the Ministry of Education. And it is for that matter that when Modi ji did a reorganization of the ministries recently, he made Dharmendra Pradhan, he is the Minister of Education and Ministry of Skill Development. The reason is previously they used to work as 2 different ministries and they never talked to each other. So Modi ji knew all this nonsense going on in Delhi. So he's made Dharmendra Pradhan Minister of both the ministries, And Dharmendra Pradhan is like Gadkari, he's a go-getter, kaam karne wala aadmi hai. And we have corresponded with all the key people in both the ministries. They all have a lot of information. We write to them very regularly. We send a lot of material.
Dr. Krishna, thank you for your time. Don't mind just going over.
No, I'm sorry. I made it very late.
Fine. That's fine. Yeah. One quick question. So everything is solved now. The problems are solved now in India, or we could have learned slightly, if you don't mind me saying, by a specific example of what is the most high priority skill that we lack in the country from your vast experience. Is you provide a lot of background, which is great, and what you achieved. But for us to sit here and understand what is the greatest skill from your understanding that is lacking in India?
See, what is lacking, if I'll be very blunt with you, because I have also been a manager, I have run companies, I have created companies on the National Stock Exchange, Bombay Stock Exchange. The biggest vacuum in our country is lack of soft skills. There are 12 soft skills, which we have a whole team of people. We conduct soft skills training. Because if leadership is lacking, but one of the biggest problems of leadership is they don't have soft skills. In the medical sector, there are a lot of very good doctors, but they don't know how to communicate. We have a lot of very good engineers. They don't know how to communicate. They don't want to work as a team.
Dr. Krishna, sorry to interrupt you. Sorry to interrupt you. What about ethical skills?
No, that is part of it. Ethical and business skills and ethics and business ethics is all part of the soft skill program. So if you have any questions, I'll send you the list of the 12 soft skill areas which are important, which are really missing in India. Whether it is engineering or medical or even BCom, and any other normal college degree.
Thank you. Dr. Manji wants to say something. Go ahead, Manji.
Yeah. Thank you very much, Krishnaji. And of course, I've known you now almost more than 15 years. And I found you somehow that I read about you and then I located you. Then I had you in our conference in Hyderabad first time. Remember in 2006. And ever since we have been working. As regarding soft skill, we have a good person here, Dr. Manu Vora. And he has been giving in the night soft skill lectures throughout the country. He's given in many universities. He is now hooked up with the AICTE and he's working with the AICTE to get this thing done then. He has done to IITs, he had done to one time about 450 colleges in Gujarat. He was able to speak to the students and on that. So we had him.
I'm very happy.
So we have a person who is also engineer from BHU, IIT BHU, and even in IIT Chicago, we did PhD here. And he runs also the Blind Foundation for India. So he has donated more than $4 million to help eye care in India for equipment and the Ramakrishna mission. So I just want to let you know. And what we want to know is that policies are, as far as skill development, are as you thought they should be? Are they there? Is good implementation going on? Are you following on implementation?
Yeah, we are following on because I'm on the advisory board of India's only education magazine called Education World in Bangalore.
Yeah.
And for the last 15 years, I'm on the advisory board. Actually, things are very bad, because people of India want a degree. Even our cleaning woman, she wants her children to do degree course. So I asked, why do you want a degree? They said, nahi to shadi nahi hoega. So they are preparing their kids for wedding and shadi ke liye. They don't care whether they can earn money or not. So even the poorest people, as I said, even today, the number of colleges in India is 60,000. And the number of skill centers, which has gone up from 5,000 to about 16,000, is very low. We should have close to 2.5 lakh to 3.5 lakh skill centers, So the question is, there is a general feeling in the country that skill building and vocational training is meant for the very low class people. And degree is meant for the high class. I will just give you one story if I have 1 minute time on. Can I tell you one actual?
Merit to speak now, or you want to his left?
Yeah, I would like to say now if you guys are up to it.
No, it's Dr. Mohan's call.
You see,
what you want to do
when I was leaving my last position as president of the company, an Indo-American company, my driver said, "Ke sahab, hum aapse, my son wants to meet you. He also wants to be general manager and president of a company." So I called him and I talked to him and I said, "How many children do you have?" He said, "I have a daughter also." I said, "What does she do?" He said, "She is very interested in hairdressing, which is a useless thing. And we discourage her. Usko hum bolte tum shadi kar lo." Any case, that boy I met, that boy was adamant he wanted to do some MBA. So his father spent all his provident fund and sent his son to some Ratfati college in Dadar 2 years and got some sort of a diploma on MBA. That son is now working as a peon in some office in Bombay. The daughter, she learnt on hairdressing. She now has her own hairdressing salon. She's employing 20 people and earning 3 lakhs a month. She, in fact, is supporting the family today. So the question is this, that this whole approach that we must do a degree at any cost is hurting the economy. And I can tell you, when I went to Germany the first time in 1963, 20% of the youth were going to college, 80% were learning a vocation. Even today, colleges in Germany are open. The best colleges, you can get admission very easily. Nobody wants to go to college. They want to learn a skill, and their apprenticeship starts from the age of 14, 15. So the question is, this mindset ke liye, this handbook which we have made, Mohan, this handbook we have made is only for big mindset change, which is still, there is a bug in our mind that we must get a degree. Vocational training nahi chalega, which is very sad because the highly skilled people, say the carpenter or the mason or a plumber or a AC repairman, or they earn 1 or 2 lakhs a month. A good welder in India earns 2 lakhs a month. You can't get them. While an engineer or an MBA gets hardly 10, 20,000, 30,000 a month. These guys earn 2 lakhs a month. So the question is, ये mindset change होने में time लगेगा. The state governments have to do their bit, which they are not, and it'll take time. But I feel that since the ministry has been set up and since they are gradually expanding in all the states, all the districts, I'm sure it will happen. It may take, I don't know, hopefully not too much time, but thoda time lagega. But it is moving in the positive direction. But the rate of change is very slow.
Yeah, thank you very much for sharing this experience. I have my own experience of life, but somehow they're okay in the studies. So I finished my college and all that. But my 3 younger brothers, they didn't do it. and they went to college. They tried it. They were not doing well. So I said, "Make start your own thing now." So we trained in some business, and they all started business. They tried different things, and then finally they found something which they can succeed. So they are both, all of them are employing people for last so many years, 15 to 20 people,
Absolutely.
and
Absolutely.
they didn't finish the college. And I worked all my life for others. Of course, I'm doing this, but post retirement, the work which I am doing is enjoying most, and that I think is the real work of my life. And I think many of us who are taken the retirement, we are enjoying that how we can contribute positively to society, and that's one thing. But degree is not required. I learned my father's business when I was 15 years old. I learned another business, printing business, when I was 16, 17 years old. So all those things, skills I added as I was going along, apart from my studies. But studies have a value at a certain level, but not everybody need to do. If you are not able to grasp the material, then yes, go ahead and try at something which you think you can do. Thank you again.
Absolutely.
Yeah, and it's getting late, and Dr. Anil Mehta will be talking. He's the principal of Udaipur Vidhya Bhawan Polytechnic. They also run ITI and all that. But of course, he's subject to his main only talk on water today. He's done work with the lakes in Udaipur and other areas. But he can add something to what you said first few minutes, and then he can join us. Thank you.
Okay. Thank you. Thank you, Mohan. Thank you.
Thank you. Bye.
So, am I audible? Am I audible?
Yes, yes, you're audible.
Yes. Yeah.
And my screen is visible, perhaps, I think.
You are using your camera only, not sharing any presentation.
Okay, just let me see. Uh, just a minute. Can you see now? Can you see now?
Something is coming up. We'll wait for a second.
Okay.
I think we are. What is saying? Don't share the entire screen. Share just a tab or a different window. So I think
Okay.
you're sharing the entire screen, right? That is the message I'm getting.
Let me see.
When you start to share, there are three choices, right?
Yeah.
So,
entire screen, a window, a tab, huh?
a window. Try to do window.
Window.
And then you can toggle to that Alt mouse keypad. Go to that presentation and share that. If you can see it, then we can see it also.
Okay. So, is it visible now?
No, we can see your face.
Okay. Let me again try. So then, where do I go? I share an application window.
Yeah, go ahead.
Let me see. Is it visible now?
Yeah, something is coming up. Yeah.
Can you see it now?
No, we're seeing a blank screen, a black screen. So I don't know what are you sharing. Yeah.
Let me again try. Otherwise, I will speak. Let me see again. Some technological problem, huh? Or I am not getting it, perhaps. So entire screen, a tab. Let me go to the entire screen first. So
and select the screen on the left side. You have to select the screen, so it gets highlighted.
So two screens available. One is the this Google screen. Let me see again. Then share. Can you see it now?
Yeah, we can see it now. Yeah, thank you.
Yeah. So I think the title sheet is visible now, huh? If that is okay, then I can continue.
Yes, it's visible.
So I will go very quickly and some of the points which are raised by Dr. Krishnan about the skill development, about the soft skills, and the importance of local language. So I will cover that, but let us first see the what is the relationship between water and poverty. And poverty is usually defined in terms of the people not getting enough calories like that. But if you define the poverty in terms of water, so if you are getting a contaminated water, or you are not having access to water, or you are not having any alternative source of water when your main source is contaminated, this will raise the poverty. Or those who are living in water borne disease area, or the livelihood and productivity is affected because of the flood or the drought, or the women and the girls are spending more time on collecting water and not able to get the education and other things. uh, uh, and those who are living far from a year-round supply of safe drinking water, if the people are not having safe sanitation, so all these are considered as the water poverty. The concept, which is not new, I will not call it an innovative approach. This is basically the approach of Bharat, what we call the Indian approach. Because if you go in the text, in the scriptures, you will find that there is a concept of Samagra Jal Sansadhan Prabandhan, and now it is known as the integrated water resource management. And the definition is given by the Global Water Partnership. I am not going with the definition; you can read it. But when we started, about doing this, we developed a tree model. Sometimes I call it Anil Mehta IWRM tree model. And the if you see that there are many issues written, like the afforestation, water resource development, drinking water, horticulture, agriculture, sanitation, biodiversity. If you work on all these issues, which are basically water based, there will be poverty elevation. You can see the fruit, one fruit, this is the poverty elevation. And the four important things which are required to achieve this are the enabling environment, which are basically the policies and plans, the governance issues, the technological options, but most importantly is the stakeholder participation. And so we started with that. Let us involve the stakeholders, build the capacity of the stakeholders, diverse stakeholders, involve in the process, involve all the citizens, so that we can achieve the what we call the integrated water resource management. And if it is achieved, the people will get enough water for domestic requirement, for the agriculture requirement, for the industrial requirement. Also defined that even if you are having a water, and if this water is not potable, we'll call it potable water drought. So we also expanded the, and it is already in the in the academics, but we expanded this idea of drought in the domain of public, that let's define drought that so once one that you are not getting water, other is that the water is there but the agricultural production is not there. uh, the aquatic life, the aquatic ecosystem is disturbed. So this is how we started, and then I will not go with this, but uh, uh, we because time is short, uh, we arrived with what we call this this capacity building modules, and which Mr. Krishna was saying that it should be in the local language. So we developed modules. Uh, First module which was developed for NGOs, for farmers, and for the Panchayat Raj representatives. And we developed in both the languages. I mean, the English is of course required, but we developed in Hindi. And our all our training sessions were in the Indian language. I mean, the local dialect, that is the Mewadi or Rajasthan or Marwadi, what you call. And this is how we invited many PRIs, many farmers, women groups, and the NGOs who are working in water sector or in the development sector. And we started talking with them that how can we work on all these aspects and can elevate the property. uh, what is innovative is that we develop the modules for politicians and for the administrative officers. So we deliberately not titled as the training module for the administrative officers, but it was meant for the for the political leadership and for the administrative officers. And our idea was not to go, I mean, that to go very modestly, to approach them very modestly and request them to please come. We would like to share something on water. How can we, to establish the integrated water resource management? How can we, work on scientific agriculture, horticulture, livestock improvement? How can we manage the biodiversity? What the administration can do, what the political parties can do. So like that, we started and we conducted many sessions. So this was basically a project sponsored by USAID, and we did it for 3 4 years. We also developed, this capacity building manual based on the state water policy of Rajasthan. Uh, then the smart city project came, and we also defined how should we pursue the smart city, and what should be the exact meaning of a smart city. So smart city is not just the gadgets, but if you are getting safe water, safe sanitation, if your mountains and hills are protected, if you are having enough groundwater, if your rivers and lakes are conserved, if your traditions and culture are conserved or revived, then you can be smart, or your city or your village could be smart. So this is what we started building the capacity of people, stakeholders on various aspects of water resource management. Recently, we have also released the module on ecocentric urban planning and development. We are conducting sessions on that. So I would not say very innovative, but our firm belief is that the importance is to what we call, sometimes we call the citizen science, that scientifically train, scientifically update, build the capacity of the stakeholders, and then involve in that the process of water resource management. If you can do it, you can alleviate poverty. You can attain a water sustainable society. So one project which we did on a river in Udaipur, on a stretch of the river, and I also already presented this in our last session of IDCA, that the stretch was very very polluted. It was getting domestic waste, industrial waste. The condition was very very bad. So we involved the local stakeholders, villagers, sarpanch, administrator, even in the industry, the Udaipur Chamber of Commerce and Industry, and we started this project by introducing a consortia of certain plants and microbes, and within 3 months, we changed the entire ecology of that stretch of river. So we could get the entire, I mean, food web in this dirty water. The people started fishing. So the important or the beautiful thing about this project was, one is the involving the citizens, diverse stakeholders, and then introducing a low cost eco technology, what we call the phytoremediation or bioremediation, and we could revive it. So this is the one example of and it increased the agriculture production in that area. So this is again this. Then sometimes when you talk about the pollution control or the environmental congestion, we talk about the 3R or 4R or 5R. So we expanded the definition up to the 10R, and we are educating the people on this 10R. And the important thing, first point is that let's start respecting the water. So I will go little more rapidly. So this is how we can the inform the citizens and involve them in maintaining the water resources, and to get the proper groundwater, and the rivers and lakes are properly managed, and you get water for agriculture and everything. So we started training the people on all these aspects of water. Then involving them, it's like a co-creation. We developed an integrated plan, and then we submitted to the government, and in 2008 or 9 we could get a 116 crore rupees project on the conservation of Udaipur lakes. So this is our approach diagram, but this we have implemented in Udaipur, and that project was implemented. Recently, we are doing a project with Denmark agencies. This project is sponsored by the Danida, and the partners are the University of Copenhagen, Development Alternative, Vidhya Bhawan Society, then the Geological Survey of Denmark, DHI, and we are doing the integrated water resource management project for the Ahar River of Udaipur, which is basically Udaipur. And here also the important point is, what I have told is the citizen science, where we are training the citizens. We are taking all citizens along with us and involving them in, measuring the water, measuring the rainfall, then how we can manage and restore our groundwater and surface water. So this project we have started, just it is in the process, and we have done a lot of work. We are inviting students, local citizens groups, uh, to come together and, to find the solution for the lakes. So other than the technological aspects like hydrological modeling and, water quality monitoring or the mass balance, the good point is that we are including stakeholders. We are using the local language, the Mewari language or Hindi language, and we are doing this project. Another project about which I would also like to tell is the Marvi project. And in this project, it has been implemented in some part of the Udaipur district and some one or two district in Gujarat, where we are involving and, training the local villagers, and through them, we are trying to achieve the groundwater balance, agriculture production, good drinking water availability. So this project we have very successfully implemented in the Udaipur district and in some districts of Gujarat. Basically, it's a project of Western Sydney University, and the team leader is Professor Basant Maheshwari. So in just 2 3 slides I will finish. So this how we'll do that. We train the villagers. We call them the select some so energetic youth. We train them on the all this groundwater science. We conduct many discussions with them, and then these Bhulja Jal Jankars, along with the group of scientists, they develop the maps, they measure the data, and then communicate it to the villagers, general villagers. And based on the success of this project, the government of India has launched what we call the Atal Bhujal Yojana. It's a 6,000 crore rupees project, and it would be, I think, it would be implemented in 8 states of the country and some district of the Rajasthan. So this is, the how the Bhujal Jankars work on the all this data collection and measuring the groundwater, measuring the surface water, then communicating it with the villagers, communicating with the scientists. So this is what how we are doing, and this has resulted in, the increase in production, what we call the, the subjective well-being, the objective well-being, the enrollment in the schools has increased, have increased. So there are many the good outcomes of all these activities which are done in Marvi project. So with this, I think I should finish because the time is very short. I've prepared a very long presentation, but I think I will share with Mohan uncle, and if there is any question, we can talk on that, and we'd be happy to answer.
So water is very worrying from sitting here. We look at India, the water scarcity that is coming to India is a very most worrying problem as such, right? So what is you are doing a great job. Apparently, you're doing a great job in trying to recharge the groundwater, rainwater harvesting, everything. So what is the scale of the problem? This water stress that everybody is
See,
talking about.
yeah, so I will take just 1 or 2 minutes. Let's take the example of Western Rajasthan. We are just having the 100 millimeter rainfall, and if you see the society of this Western Rajasthan, Shekhawati area, Churu area, or the Marwad area, we have got many big entrepreneurs from that area, whether it's Anil Agarwal or the Ruia or Bilda. So this idea of water scarcity, and when we talk this scarcity in terms of the sustainability water index, that we should have at least 1,700 cubic meter of water for each person. See the Western Rajasthan. So this is problem is not of the water scarcity. We are having enough water, and our society is trained, educated, and capable to manage the water, but we have lost all these traditions. That's why I'm giving the example of the Western Rajasthan, where the rainfall is just 100 millimeter, and the society is very rich, the culture is very rich. The society is enterprising. It is also written in the Vedas that, if I could remember exactly, Yopan Matam Vedam Ayatanma Bhavati. Perhaps I have not pronounced it properly, but Those who understand the potentialities of water and work on water, they achieve the true wealth. So this is what Western Rajasthan is doing. The problem in the country is the poor management of the water resources, whether it's a surface water or the groundwater. As such, based on our experience of Western Rajasthan and even of the Udaipur, I don't think that there is an actual water problem. That's why we are training the people on integrated water resource management. Whatever the water you are having, manage it properly, manage it scientifically. Don't depend on the scientist. Train yourself as a scientist. Use your own traditional wisdom, and then conserve the water resources. So by the the global terms, or the terms of the terminologies of the World Bank or FAO, of course the India is water stressed. We are having less than 1,000 cubic meter per capita availability of water, but based on my experience, I would say that if you manage the water, there is no problem of water in country. Is that sounds good?
Can I make a small observation?
Yeah, please, sir.
Can I talk?
Yeah, please.
I just wanted to mention that we are working with large number of districts in Maharashtra where there's hardly any rainfall. And in the last 2 years, we have increased the water table from 400 feet to 50 feet. And now the farmers are getting 3 crops a year. And in fact, our entire project, we do it in a very simple way. I don't want to tell you the details right now. But Ministry of Agriculture has loved our work, and we have now gone to 5 states. We've gone to UP, we've gone to Gujarat, we've gone to Karnataka also. Basically the BJP states, because the Congress people want to make money. I'm sorry to say, we are not providing any high pressure pumps and all that. And we are just using some common sense and very low cost effective way to increase rainwater harvesting. So I agree with you. We congratulate you. Good work you are doing. And I think this is what needs to be done. 20 years ago, when Suresh Prabhu was involved with interlinking of waters, I used to meet him in Delhi and in Bombay. I said, sir, interlinking से काम नहीं चलेगा. ये जो अपना 6 लाख गांव है उधर आप रेन वाटर हार्वेस्टिंग शुरू करिए. It took me 1 or 2 years of lobbying. He finally agreed. Then he rings me up in February 2004. He says, Atalji has agreed with your idea on rainwater harvesting, but we will do it after the election. They lost the election. वो 10 साल और चला गया.
Dr. Mehta, I just want to know what we, as doctors, what we worry in all the villages is portable water, as you said, water which people can drink with no infection and all that. Because most of the children have waterborne diseases we still have in India, which are treatable. That's preventable and treatable. So what do you think how far have we as India reached in giving portable water to all the villages?
See, the water quality in the country, whether it's a urban area or the rural area, the quality is very, very bad, and that is because of many reasons,
Yes.
But what solution we can provide? And
Yes.
the simplest solution, which is most cost effective, is what we call the SODIS, solar disinfection. And solar disinfection, when I say, it is not a big plant per se, but you just take one glass bottle, vertically paint it half through black paint.
Okay.
Put it in a sunlight, right?
Okay.
So the black portion towards the sun, and within 6-7 hours, whole water would be bacteria or virus free, right? So this is what we have written in our modules. I will share all the modules with you.
Oh, that would be nice.
So if you are having any pregnant woman in your house, or children in your house, infants in your house, just take 2-3 bottles, paint them half black, put them in the sunlight. Even if it is a cloudy weather, 12 hours the water would be bacteria and virus free. So this is what is required. Otherwise, in the country, if you go in any hospital, leave the corona, half or more than half of the hospital beds are occupied because of the waterborne diseases.
Exactly. That's what we are facing.
And we cannot, the country cannot sustain, the people cannot sustain the big RO plants or the demineralization plants or the ion exchange like that. We should go with this simple solution. Even you cannot afford the boiling of water,
Yes.
You cannot afford. But this, glass bottle, paint it half, put it in sunlight, black portion towards the sun. Within 6, 7, 8 hours, the water would be bacteria free.
That's wonderful.
That is what we are suggesting to the villagers.
Oh, that's very good. No, that has been worrying of us, because wherever we go in the villages, we find the potable water, which is the issue. Not having water. No, they have water, but it's not portable. You
And
can't
there
give
the,
them.
there the various biological methods also. See,
Yes.
so in the such areas we should go for the moringa tree plantation, right?
Okay.
What you call the session, and we should
I know. Yeah.
and if people start eating session, the pulp or the leaves and all that, it would address these waterborne diseases and
Oh.
the increase the nutrients in the citizens. So this all this problem of anemia and the nutrient
Actually,
deficiency
we
would
use
be addressed.
moringa trees for anemia. That's what we recommend.
Yeah.
But
Yeah.
this is very interesting what you're saying.
Yeah.
We'll get in touch with you regarding that. Thank you.
Yeah. Other thing is you can put the water, store the water in copper vessel, and for 48 hours, and then it will be all free of bacteria.
But sir, so the places where we go to, they don't have any containers sometimes. But this is very practical. Plastic bottles are now
No
available.
plastic bottle, glass bottle.
Glass bottle. Oh, glass bottle. Okay.
Yeah.
So that is
So
more practical.
plastic is very dangerous,
Yeah, I know.
Yeah.
That's what I was wondering. So the glass bottle. Okay, all right.
Yeah.
It will be easy for us to give them glass. This.
They are having
Other thing is that my brother in Udaipur, he has been promoting rainwater harvesting for
Doing
last
great work.
about 15-20 years. He got about 2,000 doctors, most in Udaipur, all putting their rainwater harvesting system. Recently, he's been working also on cleaning and recharging the old bavdis. All the villages, we had water systems. Talab, those all need to be cleaned up. They need to be recharged. You can put the rainwater harvesting also in the in the wells. And we done some in our town, even the hospital well, which was not used. After the water supply started, the disuse of all the wells, and they become garbage dump places.
Exactly.
So getting them cleaned up, you have talked to the panchayat people and all the municipal people to get them cleaned up and becomes a extra source of storing water and getting water, because water supply which the government is giving is hardly available for a few hours. And, and the needs of water have increased than what it was 20, 30, 40 years ago. With so many things happening.
Also, I think we should teach water auditing. Like, I mean, teaching people not to, sometimes flowing water, if water is just flowing and they're not doing anything and chatting with each other. So that also is very important.
That we started with the university youth, that let's go the water audit of your own house, then neighbors left, neighbors right, and then for the entire colony.
Exactly.
But one more thing, for the sources in villages, we can use what we call the chlorine bleaching powder.
Yes.
But the important point about bleaching powder, that dose should not be heavy.
Yeah,
Otherwise, it will work. It will react with the organic matter and put the THM, which is again very dangerous. So with 1 gram of the bleaching powder, you can treat 100 liters of water. But if you want to treat a well, you cannot directly put the chlorine in the well. There's what we call very traditional local method, the matka paddhati, pot method. So we take a pot, this earthen pot, put some holes at the bottom, right? Then we make a 3 layers. One layer is of the pebbles. Then say we need 5 gram or 10 gram of the bleaching powder, 10 gram of bleaching powder. I'm just saying arbitrarily, plus double quantity of sand. Then again a pebble layer, then a white cloth covering. Put it in the well, and based on the recharge or the daily recharge of the well would be bacteria free, right? So this is also recommended by the government of India. So we have included all these points in our modules, so that people can very easily
we'll ask for it. That will be
I
good.
will send this. So these are these cost effective, the most adaptable, rich in the public, even simple villagers can do it, and there is no cost.
I think that is what is
in
important.
25 rupees or 20 rupees you can get 1 kg of bleaching powder. Yeah.
Abhi, you were telling us, but that is very important. We NGOs must learn to talk the people's language, who we are teaching, rather than teaching them in our way. Find out their methods and teach them what they know.
So most important point is, madam, just what Mohan uncle is saying about the PC Jain. So when he goes in village or in Oni Bawadi, he sings in Mewari language. He even dances there.
Yes.
So no English. The problem with we people is that we write everything in English. Even we produce any module or a study material, we produce in in English, not as Mr. Krishnan has says that in all local languages. The
Uh-huh.
most important thing is, build the relationship with the local community, and for that
Exactly.
you have to be in their own language,
Own
otherwise you will not
language.
achieve anything. This is the
Exactly.
problem in citizen engagement everywhere.
Yes. Yes. Very nice, Dr.
Yeah.
Mehta. Nice talk.
Other point I want to add, one of our members, Cycle Foundation in
Mm.
Gurgaon, they
Mhm.
have developed a filter for the villages, household villagers, and which was approved by United Nations also. So I can
Okay.
connect to that, and it is not that expensive. And once they
Okay.
have, their whole family can get good water.
Oh, lovely. That's nice.
So
That's
we
very.
were working on that. We have persons. They also build a lot of check dams in Haryana,
Great.
Gurgaon district. A lot of work they've done. So to raise the water level, get the quality of water improved that
Mhm.
way. So all the wells will be charged,
Yes.
those things. So and also Procter and Gamble has some powder they give to add to the water. It makes it bacteria free. So I think right now some organizations are distributing there in India, and it's probably available through non-profits. And I'm
Mhm.
trying to get somebody else to do in India through an organizations which is both here and India. So that way we can get the support from PNG CSR funds here and
Yes.
to buy the stuff there in India.
That will be nice.
Yeah,
Thank you very much. Thank you very much,
Thank you.
Mr.
yeah. Thank you. And
Thank
I think Avij is there.
Yeah.
You wanted to add something comments on that what Krishna Khanna said about vocational education, since you are the
Yeah.
principal of.
So so we are running, this all this skill development. Am I audible? Yeah.
Yeah, yeah.
So we are running these skill development courses in Vidhya Bhawan since 1979,
Mm-hmm.
and we are training the people on very basic skills like say motor winding. So the every villager use the motor for motor and pump for lifting the water from the well,
Mm.
and there are many problems many times. So if the person is trained in this motor winding, he will go in a village, on call, he will go there, will bind the wires, etc., and then get 200 rupees, right? So this is what, and our idea is to to make a person capable to earn at least 300 400 rupees a day, right? So this is what we
Absolutely.
are doing on this small skills, say air conditioner repairing, so that we are training the people on air conditioner repairing, this refrigerator repairing, then house wiring, simple things. We are taking the slum girls on the training of this beautician course. So every
Mm.
girl wants to be beautiful. So even they are getting
Yes.
200 300 rupees in slum areas. So we are doing it since 1979. We are doing number of courses, mason training. Uh, uh, Now we have proposed a course in this what COVID healthcare. How can you use the? How can you install the oxygen concentrator? How can you measure the BP? So the local, the common people should know all about this. So this we have
Exactly.
proposed
Exactly.
recently, that we are trying. How can we develop a small module on uh,
So, doctor, you were not there
pandemic
when,
pandemic care?
when I was telling what I was telling all of them. For in the COVID time, I took college students and taught them about diabetes, hypertension, anemia. Not for COVID, just to let them to know these are the diseases which affects your lifestyle, right? And there is no cure for them, and how you can prevent it. So
Yeah.
what we did, we took this COVID as a cause and taught this college students. So we have around 100 college students in 1 lakh population. Every pada we took one person, and we've taught them how to use the BP equipment, diabetic, and all. We've got all the data. Now what I'm going to do is, if the one pada has many people with diabetes, so I'll give one person this measurement for that, and teach him and say go to the house, manage their diabetes. So I think this is how we have to get.
But I will again say that what Mr. Krishna says, the all material in the that local language. If it is a Marathi, then it will
Yes.
be Marathi. If
So
it is
if we
Rajasthani,
are
let's do
taking
it in
local
Rajasthan.
people, we have to do local. We do in
Yeah.
local language. That's
Yeah,
right.
that
Okay,
has.
everybody. Thank you very much. It was a very
Thank you, Rohini ji, Dr. Chowgule, and nice to meet you here.
nice
And
to meet
we
you
look
all.
forward to working with you, learning from you, and see how we
Absolutely.
can is another way of is to multiply all these effects in different parts.
Exactly.
That's the thing. We
Exactly.
cannot do everything. India is so big and so many problems. But we are all doing something. They are all complementary. It's not by itself. They are all connected with each other. Water is connected with healthcare. We know
Yes.
that one. Water is
Absolutely.
connected with education. If you don't have water, you can go to school. Or we have to spend time in getting the water is most essential thing. It's a life source. So all
And if you don't have health, you can't do anything.
yeah, but without water, you cannot expect health. You cannot
Yes.
expect food. You cannot,
Exactly.
all these things are connected. So water is the foundation. That's what in our acronym we have created is wealth, and that starts with the water. Water,
Fantastic.
education, environment, agriculture, livelihoods, technology, and health. So all
Yes.
these things we combine into one. All these are together to create the wealth in the society. So
That's good.
so that's our
That's good.
economy. If you see on the website, there are a lot of information. Please check it and
Yes.
browse it and see if
Absolutely.
anything else we can do.
Yes.
Last 15 years, 17 years, we have put a lot of good stuff on that. Many presentations, videos, and all those things are there. So
Just a curious, this. How did you think of Impact India Foundation? How do you think of inviting us? I was curious about that. Where did you hear about us?
Well, I think it is great, and you are doing great work. And I came to know about you only. I was dealing with a little bit with Neelam. We had a couple of correspondence. He was trying to raise some money for the tribal people and for feeding them and all that.
Yes, the Saigal Foundation gave us a lot of concentration. They gave us around
Okay.
30-40 oxygen concentrator for our
Yeah,
tribe.
yeah, I did share with them, our group, all the information. So whosoever could support. So I request everybody to please turn on your camera. So I'll just take one picture since everybody left. But those who are in the end, they are the winners. And want to share you. Dr. Reddy, please share. Dr. Reddy, are you there?
We have to thank Avi. He did a good job of introducing
Avi
all
did a
the
good
people.
job. And of
kept
course,
everybody else on our feet.
yeah, this is all being recorded anyhow. But I just wanted to make sure we have some picture also here with us. Thank you.
Thank you.
Very much.
Thank you.
Thank you.
Yeah, we'll keep in touch. And
everybody.
so please sharing what your things are experiencing. Then I can maybe connect with somebody here or there, wherever I can. Whatever the knowledge I have last 17, 18 years, in this field, I'll try to juggle and try to coordinate things and connect and create collaboration.
How long you will be in India? How long you will be
in
India? How long you will be there?
Me? I will be there at least 4 months.
So are you in Delhi or in which part of India?
I'm in Rajasthan, Udaipur. That's where Dr. Anil comes from there. I spend there most of the time there, but I travel also. We have a group in Jaipur. We do in the college our conference every year. We were doing before in different cities in person, but right now we are doing online in person in Jaipur only. But we have done meetings in Hyderabad, Bangalore, Kanpur, Udaipur, Jaipur, Delhi, Kochi, all over India. We have been there with the Pravasi Divas, and we were doing along with the Pravasi Divas before. But Jaipur one is going on last 7-8 years, and we started the social entrepreneurship program in the college, where students, MBA and computer students, they take part into doing internship with different NGOs, and they make presentation at our annual conference, or 10 or 15 of them, and they group of team of 5 or 6, they go and work on a project for 2 weeks, work with the NGO and trying to learn how they're doing and what they can help them also. So that's a program you might like to replicate other places because it makes them aware of the social problems and also ideas of serving the society and getting into that. So when they go and work in the corporations beyond that. So thank you again.
Thank you, everybody. Thank you.
Yeah.
Thank you.
We will have a video. We'll be sharing the conference, this meeting. So right now, thanks again, and
Thank you.
talk to you. See you later.
Bye.
And tomorrow, please join us and tell everybody else to join. And Anilji also, please join tomorrow.
Yeah,
Support
yeah,
us.
sure.
We have
Sure,
a
sure.
speaker on livelihood and education, which is your subject, and both the things
Yeah.
are there. Krishan Khanna ji had something tomorrow. He was traveling, so he asked that if we can do today. So that's why I had him come today. So please
Sure,
be
sure.
there in time so that we can support each other and learn from each other. These wonderful things people are doing, and I'm surprised people are not here today as many as they should be. But we'll do whatever we can, and then of course I'm sharing the whole video with our group and everywhere. Okay.
Thank you. Thank you.
Thank you.
Good night.
Thank you.
Good night.